Okay, we're going to get going. Sorry for the long wait. We are on the floor with extended debate. We're going to start right off the bat with Chair Kelly and Senate Bill 720, Madam Chairs, if you want to go up there. And I'm going to call her panel Stevan Ellis, Sierra Lee, Rhonda Bell, and Tammy Bresnahan. I don't know if all four or three or the whole panel of four is still here, but we'll do that, and then after that, we'll take the one witness favorable with amendment after we're done with this panel. Madam Chair, why don't you proceed to tell us about the bill?
Thank you. Colleagues, Senate Bill 720 is here because of concerns shared by the Maryland Department of Health regarding the need for the licensing and the professionalizing of the over 1,600 assisted living entities operating in Maryland with no licensure currently required, and with grossly inadequate oversight, most pronounced among the more than 1,200 smaller homes often located within private residences of owner-managers. Maryland only requires an 80-hour training course for assisted living owners, many of whom operate several homes with 2 or more residents in their private residences. Senate Bill 720 renames the new State Board of Examiners of Nursing Home Administrators and as the State Board of Long-Term Care Administrators, which will now encompass, with the passage of this bill, entities that are in the assisted living business. While at least 15 states have adequate regulation of long-term care administrators who serve patients in assisted living facilities, Maryland is not yet adequately regulating administrators of those long-term care facilities which serve elderly patients who typically have less income but greater disabilities than patients residing in nursing homes. Senate Bill 720 includes comprehensive and necessary requirements for administrators of those long-term care facilities, serving patients who tend to have greater physical impairments and fewer financial resources in many cases than those who are residing in nursing homes. Senate Bill 720 reflects the fact that whereas nursing homes are regulated at both the state and federal level, assisted living programs serving patients usually with fewer resources and with greater health care acuities are only regulated by states such as Maryland. To date, Maryland has insufficient regulation of residential entities serving assisted living patients without adequate oversight from any government agency. Nationwide, relatively lower income seniors residing in assisted living entities depend largely upon Social Security and or pension checks of the residents as the sole way of operating. In many cases, assisted living residents are forced to sign paperwork designating the assisted living managers as representative payees of the residents' Social Security and or pension checks. Assisted living residents nationwide and in Maryland tend to need assistance with eating, transferring, bathing, and with toileting to a much greater degree than do nursing home residents. This is true nationwide and not just in Maryland. Senate Bill 720 will professionalize Maryland's assisted living programs for the first time and will require relevant education, criminal background checks, and licensing of all assisted living managers. Senate Bill 720 lays out the protocols to be followed when an assisted living program loses its licensed manager. If a legally qualified assisted living manager is not available within the 90-day vacancy period, the owner or other appropriate authority shall immediately appoint another non-licensed acting interim manager who must immediately file for a provisional license. With good cause, the Long-Term Care Board may extend the initial provisional period for no longer than 30 additional days. Once Senate Bill 720 becomes law, passage of a criminal background check will be a requirement for every appointment of an assisted living manager, unless a new appointee has previously passed a recent criminal history records check. All other requirements for the position of assisted living managers, including education and minimum wage, are also specified in Senate Bill 720. This bill specifies all of the duties of the Maryland's new long-term care board being created with this bill. When attempted to license an interim or new permanent replacement as an assisted living manager. Senate Bill 720 specifies circumstances under which the long-term care board may waive training or experience criteria for licensure of a manager, as well as what protocols and considerations apply whenever there is any blemish in the criminal history record of an applicant for the position of long-term care manager. Senate Bill 720 specifies a 2-year term for a long-term manager position. It will be the prerogative of the board to set continuing education program criteria for review of information resulting from criminal background checks of assistant living managers, if there are any such background checks needed. Attached to my written testimony is a 2020 pre-proposal concept paper drafted by the State Board of Examiners of Nursing Home Administrators, citing the need for the renaming and licensing of assisted living facility managers, as well as a press release from the Office of the Attorney General informing the public of a 2019 indictment of 3 unlicensed facilities that were exploiting residents. There's also a chart of assisted living licensing legislation by states. In light of all of these considerations, I ask for your favorable report of Senate Bill 720. Thank you very much.
Okay, thank you, Madam Chair. Before we go to the panel, any questions for Chair Kelly? Okay, seeing none. I don't know if you have a particular order. Anybody want to go first, and then we'll just go down the row? Okay.
I'm happy
2
to go
minutes, and
first.
you're under our 2-minute rule.
Great, thank you.
Yep, and here's your clock, right here.
Thank you. Hello, my name is Stevan Ellis. I'm the State Long-Term Care Ombudsman, and I'm supporting this bill on the behalf of the Office of the State Long-Term Care Ombudsman. I'd like to thank the Chair, Kelly, Vice Chair Feldman, and the members of this committee for hearing my testimony today. As the Ombudsman, I advocate for residents in nursing homes and assisted living facilities. At this time in Maryland, we have over 1,600 assisted living facilities and over 25,000 assisted living residents. In assisted living facilities, residents receive assistance for activities of daily living by a caregiver and a medication technician. The assisted living manager is responsible for overseeing and coordinating the care of residents with limited support from the delegating nurse, who is not required to be on site and often only visits every 45 days and as needed as required by state regulations. Even though many assisted living residents have the same needs and same acuity level as nursing home residents, there is no interdisciplinary team, as there is in nursing homes, to help develop the treatment plan and provide the care. This falls on the assisted living manager. The assisted living manager has the authority and responsibility to ensure residents receive the best and most appropriate care possible. Currently, there is no licensure standards for assisted living managers. The benefits of this bill include professional certification that require the assisted living manager to have this necessary requirements in continuing education. It would allow public information to be available about assisted living managers for the first time, and currently there isn't any. Unfortunately, the Ombudsman program has seen very serious issues in assisted living facilities, and as recently as in the last month, we've seen facilities without adequate staff, no heat, no food, no visitors allowed, residents not being allowed to access their records, physical, verbal, and psychological abuse and abandonment, and even running unlicensed assisted livings. These are very serious concerns and at times life-threatening. This bill is necessary and will be one of the most important protections for residents in Maryland. I respectfully request that you support this bill. Thank you very much.
Okay, thank you. Why don't you, if you could pass that mic down,
Sure.
and you can put it close to your face too, and tell us your name, and then again, you've got the 2-minute clock. start with your name.
Great, thank you. Good afternoon, everyone. My name is Sierra Lee. I am the Executive Director of the Maryland Board of Examiners of Nursing Home Administrators. I would first like to thank the sponsors, Chair Senator Kelly, Vice Chair Senator Feldman, and Senator Augustine at the Finance Committee for this opportunity to provide testimony for Senate Bill 720. I come to you today as the administrative representative of the board office and to emphasize the board's support of Senate Bill 720 for the following reasons. First, the bill promotes public safety and protection, which is the primary objective of the board's mission, and it encourages and promotes professionalism, accountability, and responsibility for assisted living managers in Maryland. The Office of Healthcare Quality, OHCQ, is the state department that regulates assisted living programs in Maryland. According to the annual report and staffing analysis for fiscal year 2021, the 10th most frequently cited deficiency was associated with assisted living managers' practices. From my understanding, sanctions are not imposed on ALMs or assisted living managers, and there is no process for posting public orders against AL managers for public knowledge. With the current regulatory oversight, AL managers are allowed to circumvent discipline and liability. Maryland, compared to other states, has a high acute long-term care facility population, continuing to require more health expertise, especially during COVID-19 pandemic. As infection control deficiencies are rising, Senate Bill 720 is an extremely important piece of legislation that will strengthen the collaboration between OHCQ and the board, the standardization of assisted living manager profession in Maryland, and most importantly, the protection and safety of residents. We ask that you take this into consideration and vote favorably for this bill. Thank you.
Okay, thank you. We'll go through the whole panel, and then we'll open up questions from the committee. Ms. Bresnahan?
Great. Good afternoon, Chair Feldman, Committee Chair, Senator Kelly, and members of the Senate Finance Committee. I'm Tammy Bresnahan. I'm the Director of Advocacy for AARP Maryland. We have over 850,000 members, and we overwhelmingly support Senate Bill 720. We are a member of the Oversight Committee on Quality of Care and Nursing Home, and that's where these issues came to light for us. I know that Senator Kelly, and I commend her, has been working on this issue for over 2 years. You know, it's been brought to our attention, and that people have, that the manager just doesn't kind of know what they're supposed to be doing. And the oversight by the Office of Healthcare Quality is what I like to call regulatory light. We also have been working on the regulations, which have not been updated for assisted living for over 10 years now. And in any way, regulatory oversight has been limited. We are very concerned about the folks that are in assisted living. We know that assisted living facilities are designed for older people who no longer are able to manage for themselves and need help with daily activities. But in some cases, these folks look like they are from nursing homes, and so, especially in the smaller ones. So we ask you to look at this bill and to give us a favorable report on Senate Bill 720. Thank you.
Okay, thank you. And then we've got one final witness, and tell us your name.
Good afternoon. My name is Rhonda Bell. Madam Chair, Mr. Vice Chair, and members of the committee, thank you for the opportunity to speak to you today to express my full support for Senate Bill 720. I come before you today as the immediate past Executive Director of the State Board of Examiners of Nursing Home Administrators, as well as someone who has had the personal experience of having my own mother reside in an assisted living facility. Since as far back as the Maryland Office of Healthcare Quality's 2005 assisted living evaluation, we have known that our assisted living residents and nursing home residents were much more similar in their levels of acuity than was ever expected. Yet, in 2022, Maryland still does not provide assisted living residents the necessary public protection of oversight and accountability of those who manage assisted living facilities. Assisted living facilities are not federally regulated, which is something a lot of people don't know. There is very little accountability and absolutely no ability to track assisted living managers who move from state to state through the National Practitioners Data Bank, which picks up many things that CJIS and criminal history reports do not pick up. Maryland is a national leader in the levels of severity among its assisted living residents. In the state of Maryland, an official license is needed to become a nail technician, a barber, a lift mechanic, and an alcohol and drug counselor. But no license is required to manage a facility that oversees the health and very lives of some of Maryland's most vulnerable citizens. This is absolutely unacceptable and must change. The citizens of Maryland deserve better and have deserved better for a very long time. Senators Kelly, Augustine, and Feldman, I sincerely thank you for sponsoring this legislation, and I'm hoping the committee submits a favorable report on Senate Bill 720. Thank you.
Okay, thank you. Thank you, Ms. Bell, and the entire panel. Any questions for the panel? Yes, Senator Benson.
I just don't have words to express how grateful I am. You know, I sit here and I observe a lot, but I really want to thank this chairperson. I want to thank Senator Kelly for the work that she has put forth in this most important bill. I want to thank all of you for the work that you do to protect those dear little souls that are caught up in these homes, these assisted living homes. My mother, we had such a hard time with my mother, I just can't even express it. And so this bill, to me, is probably one of the most important bills that will come before this committee. And I want my name to be added as a sponsor for this bill, as a co-sponsor for this bill. As a matter of fact, if I had my way about it, we'd vote right now to support this bill and move it on, because it's just that important. It's shameful. It's really shameful with the way that these people are treated. These dear little souls who can't speak for themselves are treated, and you know, they get a lot of federal money. So they're not licensed. It's unbelievable. So thank you very much, Senator Kelly, for the work that you've done, and thank you for this bill. Thank you, Senator
Okay, I
Augustine.
don't think that was a question, so I don't think anybody has to answer that one. Okay, well, thank you for your testimony, and we have one additional witness, so you guys are released. Dana Kaufman is favorable with an amendment, or amendments.
Thank you, Mr. Vice Chair, members of the committee. My name for the record is Dana Kaufman. I'm here on behalf of Lifespan Network, and we are in support of this bill with amendments. We have been working, I have personally met with both sponsors, Delegate Penamelnick in the House, as well as Senator Kelly, on amendments that are being drafted right now and have been talked in the subcommittee over in the House. The amendments basically, well, let me just say, the bill does two things. So one, it does create licensure, but in doing the licensure category, it also requires all managers to take the 80-hour manager training course. Right now, those managers who are employed in facilities with 4 beds and under do not have to take the manager training course. That was done through legislation. They exempted them out. So this is bringing them back and requiring them to take the course, which we do think is important. And then again, it would require everyone to be licensed. Some of the amendments that we're working on is to ensure that the board has equal representation. It's also to cross-reference some of the regulations and the state laws regarding assisted living, so we can make sure that we have consistency, especially in education and training requirements. So, and then also, which I think is also very important, there is going to be a report that comes back. The bill takes effect, or these provisions take effect October 1st, 2024. And there will be a report coming back by October 1st, 2023 to ensure that the board has the appropriate resources to be able to actually license the number of individuals that we are expecting. Because I will say, we can pass as many laws as we want, but if we don't have enforcement and we don't allow the state agencies with the proper resources that they need, then we're always going to be back here. So with that, I'm happy to get the amendments done and to you, and we urge a favorable with amendment vote. Thank you.
Okay, thank you. Any questions for Ms. Kaufman? Okay, seeing none, that concludes the bill hearing on Senate Bill 720. And I guess we'll go next to, Senator Kramer for Senate Bill 824. And Senator Kramer has one designated panelist, Elizabeth Claiborne. Ms. Claiborne is, or?
Do you have Mr. Jeff Zucker on there as well?
He is not on our list. I will check with Tammy. So apparently not signed up. No?
As a witness, or he flew in from Texas, so I sure hope so.
Is he physically here? Yeah. Madam Chair, all the way from Texas, huh?
He flew in from Texas this morning to be here.
Yeah, he came from Texas. Well, in this case, because it's Senator Kramer, and he came all the way from Texas. So, so those are our two panelists. Senator Kramer, you've got the time to explain your bill, and then we'll take it from there.
Thank you, Mr. Chair, Madam Chair, members of the committee. Ben Kramer here introducing Senate Bill 824. Colleagues, this will be slightly familiar to you, I'm hoping, because we passed last year out of this committee and out of the Senate a very similar bill last year. And the catalyst to that bill last year is that the year before that, the Budget and Taxation Committee and the House Appropriations Committee asked our State Advisory Council on quality care at the end of life, of which I am appreciative to be a member, to advise the legislature on how we can increase the use of advanced directives, how we can get more people participating in filling out this exceedingly important document, and how we can make it readily accessible to particularly our emergency room physicians when they are needed most. And that's why Dr. Elizabeth Claiborne is here. She is one of our emergency room physicians. And she will be a spectacular witness explaining the need for this. But the fact of the matter is, we have less than 30% of our state residents who have completed an advanced directive. The members of our minority communities who have done so is drastically lower than that figure. And it is important that we get our residents to fill out these documents and to make them accessible, because of those who have, only a very tiny percentage of them have been loaded up to the statewide database that makes them accessible to Dr. Claiborne when she needs to know what are the wishes of the individual that is in that emergency room. It brings about calm for family members to know that this has been decided by their loved one who is there in the emergency room. It reduces the need to deal with, unfortunately, what our physicians are dealing with, different family members insisting that different protocols be done, and we need to address this. So, as I mentioned, the Senate passed the bill over last year. It got to the House very late. The chair of the committee, not being particularly familiar with what the subject matter was, suggested that it be taken up as a study over the interim. Delegate Bonnie Cullison and I were members of that study, along with stakeholders from all different aspects of the health industry. And this bill is a reflection of some of that work and additional work that Delegate Cullison and I have been doing. And basically what it does is that it will ask our Maryland Healthcare Commission to coordinate with a broad range of healthcare entities in the state to promote and facilitate the use of advanced directives by our residents. And really, that is it. I am shortening my testimony because I just took a look. There are pages of favorable witnesses on the bill. I did not see anyone signed up unfavorable. There are some amendments forthcoming that address certain concerns that have been brought up, and I'll tell you real fast, in response to the insurance industry and the MIA, there is language forthcoming that will ensure that carriers and providers do not have to store this information or have access to the information in the advanced directives. Hospice legitimately expressed their concern that they were pulled in inadvertently under the bill, and there's a lot of self-determination that comes with the decision to go into hospice. So that'll be addressed. We also are addressing a concern from our friends in the developmental disabilities community that they are mistakenly pulled in under the bill. There is a technical change the Attorney General is asking for. We're addressing that, and also to ensure that the Maryland Federation of the Blind will have access to these documents. Delegate Cullison and I had been speaking about whether they were prepared as of today. They're not. We were hoping that since her bill was heard the week before last, we would have those amendments, but they are forthcoming, so hopefully they'll be in place. And with that, Mr. Chair, as I was mentioning, Mr. Zucker here came up from Texas this morning to testify on the bill because he is the preeminent expert in the country on how this is done and the how the computers and the data, how it all works, how it is stored, how the database is accessed. And so with that, I will turn it over to the witnesses. Thank you, committee.
Okay, before we do that, any questions for the sponsor? Senator Kramer? Okay, seeing none. Ms. Claiborne, do you want to start, and then we'll go to Mr. Zucker?
Absolutely. Good afternoon, you all. I understand that you've had a really long day, so I'm going to just capture your attention real quick and have you all think about, have you discussed with your own family and your loved ones what would happen if you had a medical emergency and needed to have CPR or an intubation? The vast majority of you probably have not, and that is my experience as an emergency physician. I work with the University of Maryland Capital Region Medical Center. I'm a faculty member. I have a background in bioethics, and this is an academic focus of mine that is very near and dear to my heart. It is an area of medicine that I think we are really needing change in. Culturally in the United States and in this state in particular, it is not a conversation that a lot of us like to have. A lot of families and loved ones will put off conversations related to end-of-life care, death and dying, and what they would want done in the case of an emergency when an emergency is on hand. And that puts physicians like myself in a very tough position. What would be better is if we set up access and tools for patients and families to be able to express their wishes and then have that accessible to me so that if there is an emergency, I can actually get that information and respond and respect patients' wishes in real time. I'll share a short story with you, and there are many, but the most recent one was 2 weeks ago. I had a young lady come to Capital Region Medical Center, so just down the street in Largo. She had collapsed outside of going into a clinic appointment, went into cardiac arrest. EMS brought her to the ER. We did CPR on her and were able to get her back. I placed a breathing tube, and actually she woke up. She became responsive so much that I had to sedate her. But before I sedated her, I could see her with big eyes staring at me and asking me to remove the tube, and I assumed she just was scared and she didn't know what was going on, and I calmed her down and said, it needs to stay in place. 5 hours later, after trying to find her family, I found out that this lady was a cancer survivor and had a DNR in place, and we had basically resuscitated her against her wishes. So this is an all too common story that I deal with all the time. I hope that you find favorable and support Senate Bill 824 to give families, patients, and physicians like me the tools we need to do what we need for patients.
Okay, thank you, Dr. Claiborne. We'll go next to Mr. Zucker. Welcome to Annapolis.
Thank you. Thank you. Good afternoon, Madam Chair, Vice Chair, committee members, especially Senator Kramer for your leadership on this issue. It's an honor to be here today in support of Senate Bill 824, and it's a special honor to sit next to Dr. Claiborne and to publicly thank her and her colleagues for the amazing work they've been doing, not just throughout their careers, but especially these last 2 years. Nothing in medical school, nothing in residency prepared them for what they have had to endure and are still enduring. You've just heard Dr. Claiborne talk about the problem. Let me reassure you, the answer is incredibly simple. Unlike most things that you face, this one is ridiculously simple. You ask people 2 questions, you take their answers, you make sure those answers are accessible in the electronic medical record, and Dr. Claiborne knows what to do. That's it. This bill is helping people ask the questions. Who speaks for you in the event of a crisis, so she doesn't wait 5 hours to figure it out? And what are your goals of care, so she doesn't waste the time, the resources, and disrespect the patient who just spent 5 hours in stress not doing what they wanted, and that family has to live with that pain and suffering for the rest of their lives? The simple answer is to ask people 2 questions. Well, how do you do that? Society doesn't do it today until it's too late. We wait for Dr. Claiborne or an emergency room nurse to ask the patient who's already in the state of a crisis. We just have to do it earlier. And the people that talk to people earlier in the healthcare setting are primary care doctors and health insurance plans. And this bill simply says to the health insurance plan, when you're enrolling or re-enrolling, when it's somebody's birthday or an anniversary, just ask them, who speaks for you in the event of a crisis and you can't speak? And what are your goals of care? And then use the Maryland Healthcare Commission to direct those answers to the certified database that you've already created through CRISP, which links to the electronic medical records of every hospital in the state of Maryland. Yes, it should be federal. Yes, it should be global. But here we're just talking about the state of Maryland. And Maryland doctors like Dr. Claiborne can know the answers and respect the wishes of the people that they're treating. It's as simple as asking those questions. Thank you very much for your time today.
Okay, thank you, Mr. Zucker. So any questions for either Dr. Claiborne or Mr. Zucker?
And, Mr. Chair,
Yes.
if I just might add,
Yes, sir.
is that not the most soothing voice you have ever heard?
Hers.
Well, he flew all the way from Texas. He's probably a little, okay, well, thank you very much. The only other additional witnesses for the bill are Ben Steffen, so we'll call, thank you very much. We're going to call Ben Steffen up, Sharon Minneke, who signed up favorable with amendments, and then Philemon Kanzerski. Phil, I think you're there. So why don't the 3 of you come up, and Mr. Steffen, we'll start with you. You're just signed up straight up favorable from our Maryland Healthcare Commission.
Thank you, Vice Chair Feldman, members of the committee. Ben Steffen, Executive Director of the Healthcare Commission. We're here to support Senate Bill 824. I want to confirm that this bill conforms broadly with the work group recommendations that Senator Kramer referenced already. The Healthcare Commission is committed to fulfilling its responsibilities under the legislation, should you adopt it. I also want to emphasize that this is called the Health Accessibility of Electronic Advanced Care Planning Documents, but I think it could be better called, in some ways, everyone has to do a little bit to advance the use of advanced care planning, because it does assign responsibilities for payers, for hospitals, for assisted living, nursing homes, to do a small part in making certain that patients have the ability to create advanced care documents, to periodically review those documents, and to ensure through the electronic infrastructure that exists in the state to access that information when it is needed most. Secondly, we're going to be able to monitor the success of this initiative, but it does, because it requires the Healthcare Commission to gather information on the adoption of of advanced care planning documents, and we can monitor the success as we move forward, determine additional tweaks that may need to be made, and report back to you on the success of the overall initiative. Therefore, we very strongly support this initiative and strongly recommend that the committee issue a favorable report. Thank you very much.
Okay, thank you, Mrs. Stefan. We'll go to the other two witnesses, then we'll take questions. Ms. Minneke, you've signed up favor with amendments.
Thank you, Mr. Chairman, members of the committee, and thank you, Senator Kramer, for introducing this bill. I'm really here to say, don't forget the patients. You know, it's great to have databases if you can get into them and if you can read what's in them. And the amendment that the National Federation of the Blind of Maryland has suggested is just to use the accessibility standards. There's a thing called the World Wide Web Consortium that has made up these standards. They have been incorporated into Section 508 of the Rehabilitation Act. Developers know this stuff. Patients will be able to, you know, you have to fill out a form, okay? It's great if the cursor would go to the place and actually let you fill it out. That'll happen if you use these standards. So please consider the amendment and please vote in favor of the bill. Thank you.
Thank you, and I understand Senator Kramer's working on some appropriate amendments, so that'll
Correct.
work. Phil, you're next, and you're the cleanup on the bill.
Thank you, Mr. Vice Chairman, and thank you, Senator Kramer, for your leadership on this very important issue. Philemon Kondrasky here on behalf of the League of Life and Health Insurers. First, I'd also like to thank Mr. Stefan and the MHCC for their hard work in the interim on this issue. And I'd like to also thank Glenn Snyder and the Horizon Foundation for the additional group meetings that he held on this issue. There was a tremendous amount of work in the interim when it comes to this bill, and we think we've come to a place of a lot of consensus. And we're happy to continue this discussion. It's an incredibly important issue that we will continue to be at the table for. The amendments that we are here in favor of are the ones that Senator Kramer mentioned in his testimony, so thank you.
Okay, thank you. Senator Kramer.
Yeah, thanks, Mr. Chair. I too just wanted to thank Ben Stefan for all the time, effort, and energy that he put into overseeing the work group that spent a tremendous amount of time during the interim. So thank you very much, sir, and to all the folks from your office that were very dedicated. And my thanks again to all the folks who were participants. It was a very broad group of interested folks who came to the table and put a lot of time, effort, and energy into the bill that's before us. So thank you all very much.
Okay, Senator Benson.
Yeah, thank you very much. Walk me through the process. I'm an individual, and I need to fill out the form. Where do I start?
So, Senator, you're going to have several choices. Should this legislation pass, when you go to your insurance company's portal, you will have, in the course of navigating through that portal, an opportunity to be linked to a electronic advance directive function that will allow you to create it right from the insurance company's patient portal. From the providers that you use, oftentimes when you visit that provider, you will be asked if you have designated a health agent. So verbally, you can do that today. We plan on exploring further how that information can be gathered electronically in the course of a patient visit if it's not already through the electronic health record. If you're admitted to a nursing home or assisted living facility, there is a requirement and obligations that they have to make this information available. So like the vaccine rollout, what we are aiming to do is really put it all hands on deck, emphasis on whatever channel of the healthcare system you're accessing, you're going to have an opportunity to create an advanced directive. Perhaps minimally, if you're younger, all you'll want to do is designate your healthcare agent who speaks for you if you're not able to do so yourself. Others will want to provide more extensive information, perhaps fully developing what is completely defined in the Maryland Advanced Directive Law. They can do that. The electronic documents that are available exactly conform to what is required through the AG's guidance today, and we expect that to carry forward across all the platforms where it's going to be available.
It probably would be the safest way for this information to get to Dr. Claiborne would be through my doctor.
And that is the intent. There is the word electronic in it, and it presumes that either through electronic health records created with consultation with a primary care physician or a specialist, that would reside in either a electronic record repository or a standalone advanced directive repository that is then accessible through our state designated health information exchange, CRISP, that regardless of where you are in the healthcare system in Maryland, that information could be retrieved, and we could be confident that that information reflects your own preferences and choices.
But does that invade a person's privacy if it's available all over the place? I mean, how is it contained in such a way that that information is not made, I hate to use it, made public?
So I think that's an important question, and it's important to understand that if the information is gathered through an electronic health record, that information is only going to be available to providers who treat you. Likewise, if it's stored in, say, a standalone advanced directive, some of the same protections would be in place, and that could only be retrieved by a treating physician that has a care relationship with you. It's not going to be accessible to prowling eyes of the public or physicians or other providers that have no treatment relationship with you.
Thank you.
Okay, thank you. We're going to go to Senator Augustine, then Senator Bidle, and then we might want to move to the next bill. We got a lot more bills. No, it's fine. Senator Augustine first, then we'll go to Senator Bidle.
Thank you, and forgive me because I may have missed this, but there were some questions from the MIA about basically how we would know whether or not the carriers have, I'm sorry, you have it?
Yeah, because, just quickly, if I may.
Yeah.
I said that there is an amendment forthcoming to address that concern that the MIA had to make sure that the carriers are not going to have access or responsibility for storing that. So we've got the language worked out, we just need to get the amendment, and that was worked out in advance before the hearing, in fact.
Thank you.
Yeah,
Appreciate it.
Thank you.
The key point is treating providers that have a treatment relationship with a patient would only have access to this information. That's absolutely a goal.
Thank you.
Okay, Senator Bidle.
Thank you. Mr. Steffen, thank you. Without this bill, when I send my advanced directive to my hospital, for instance, is it then filed with CRISP so that my doctor can see that, or I have to give it to every doctor that requests it? What happens now?
So the answer is it depends.
Okay.
And if, since I know Anne Arundel well, they use the EPIC system, the advanced directive, that if it theoretically, and it should be, your advanced directive is stored in Epic. Epic actually has one of the best functionalities for electronic or for advanced directives, and that would be available through Epic to other Epic systems across the state. So if you happen to be injured, say hypothetically at a University of Maryland system, they both use Epics. Potentially, I can't confirm this, they would be able to communicate with each other.
Okay.
Secondarily, recent federal government interoperability requirements, barring information blocking, should allow that information that's now held in the EHR at Anne Arundel through the Epic system could be accessed through CRISP, even at systems that Epic is not the EHR system. So it should be broadly available. I can't confirm absolutely that it is today. If by chance you're using a standalone advanced directive registry, they will, as part of our effort, MHCC's efforts, if they are recognized by MHCC, connect directly with CRISP, and that would be the vehicle through which it would be available.
Thank you.
Okay, any final questions? Seeing none, that concludes the bill hearing on Senate Bill 824. We're going to next go to Senator Elfreth, Senate Bill 740. And Senator, your two panelists are Julia Worcester and Tammy Bresnahan, and we only have one additional witness. I don't know if I see, is Larry, Zecchi here? Larry, are you back there? Yeah, Larry, why don't you come up too? You're not a formal member of Senator Elfreth's panel, but you're somebody we're all familiar with, and you've been a good advocate. Why don't you come up? That you're the only three witnesses on the bill, so. Senator Elfreth, you can take as much time as you need, and then we'll go to the panel.
Wonderful. Well, thank you, Mr. Vice Chair, members of the committee. I will try to be brief, understanding the hour, and my own committee, I think, has about 18 bills left today. So, Senator Sarah Elfreth here to present Senate Bill 740, Public Health Parkinson's Disease Registry Established. This bill will create a voluntary statewide Parkinson's disease registry that will allow Maryland to more effectively monitor the prevalence of this disease while also supporting the critical national effort to find a cure. This committee knows, I'm sure, that Parkinson's disease is a chronic neurodegenerative disease that gradually worsens over time, and there is no known cure. The bill, Senate Bill 740, will establish again this voluntary statewide Parkinson's disease registry within the Maryland Department of Health that will disseminate relevant population data from patients living with the disease from Department of Health to the CDC as national research database. This MDH registry will ultimately provide researchers around the country with the best possible chance to use this data and prevalence patterns towards finding a cure for this progressive chronic disease. I have a wonderful panel, Mr. Vice Chair, so I'm just going to hit kind of the highlights. There are currently 1 million Americans, including over 100,000 military veterans, living with Parkinson's disease. Creating this state registry database will feed unidentified information, very important here, unidentified information, upon diagnosis to the Maryland Department of Health, then to the CDC. So the bill establishes the registry. It requires MDH to establish a Parkinson's disease registry advisory committee. It authorizes MDH to share the certain information in the registry with other entities, i.e. the CDC, and ensure and provide for confidentiality of that information collected under the bill and via the registry. Now, this is not a new idea. 5 other states, including Massachusetts, California, Utah, Nebraska, and our neighboring West Virginia, have established these comprehensive registries before to compile the data, monitor the trends, and track prevalence for the progressive chronic disease. 5 additional states, Hawaii, Colorado, Michigan, Ohio, and South Carolina, are contemplating similar legislation to what you have before you. Again, little is known about how Parkinson's disease is distributed among different population groups and whether these patterns of the disease are changing over time. Maryland's large and diverse population makes it an ideal candidate to join the collective of states establishing these registries in an effort to provide valuable information about this disease. Now, Mr. Vice Chair, I said yes to this bill almost immediately for a number of reasons, one of which Parkinson's is very prevalent in my family. My grandmother had it. I witnessed it firsthand. And if there's anything we can do, and this seems like a small step for what we can do to finally achieve a cure, I respectfully request a favorable report.
Yeah, well, let me just say, I have a mother-in-law who lives with us who, has Parkinson's, so I appreciate very much you bringing the legislation. The one thing I would note, because of the fiscal note, we're going to have to send it over to the Budget and Tax Committee, so you're going to have to use your magic over there to get sign-off
Yep,
before we
luckily I
can
know
move
a few
forward
folks
with
over
that.
there, so.
Any questions for Senator Elfreth before we move to her panel? Okay, seeing none. Julia, you want to lead off, and then we'll go to Tammy Bresnahan and then to Larry?
Sure thing. Thank you, Mr. Vice Chair. Julia Worcester, and it is so wonderful to see your faces again in person. I am with the Michael J. Fox Foundation for Parkinson's Research, here in full support of the bill, and cannot thank our sponsor enough, so much so she's taken all of my talking points today, so I could end right now. However, what I'd like to do is give you a little history of why this is our #1 priority for the Michael J. Fox Foundation. We were founded in 2000 and are singularly dedicated to finding a cure for Parkinson's disease through aggressively funded research agenda. And part of that agenda was working with Congress in 2014 to get the CDC's National Neurological Program up and running, which then took another additional 2 years to get funding established in 2018. Since then, we are working on getting states to upload their state registries in each state. Why? Because that data needs to go somewhere so that it can be accessible to researchers around the country as well as around the globe. We want to find clusters, we want to find patterns, we want to find whether or not there are areas of young onset, areas of are we hitting certain genders and cultures, what are the backgrounds with comorbidities, and a new area of data point that we're looking at is Parkinson's and COVID, particularly long haul COVID and its effect on this neurological disease state. As Senator Elfreth mentioned, we have 4 that are up and running. California and Massachusetts are the most recent and the most modern. And just 2 weeks ago, on February 25th, West Virginia's Governor Justice signed the 5th state into law. We hope that Maryland will be #6. Finally, I would like to address the fiscal note. We do believe that the numbers are slightly inflated. California was allotted, when they started their registry in 2017, $3.4 million over 4 years, which is $800,000 a year for 112,000 patients in their system. I don't believe a state that's 16 times the size of Maryland will cost that much. Massachusetts is using existing resources with their ALS registry, and they are allotted around $250,000 a year. Currently, the state of Ohio has stated that there is no fiscal impact. They are also using surplus funds from their COVID surplus funds, and it will be a neutral fiscal impact. And with that, I urge a favorable vote on the bill, and thank you for having me today.
Okay, thank you for your testimony. Ms. Bresnahan, we'll go next to you.
Yes. Mr. Vice Chair and members of the Senate Finance Committee, I'm Tammy Bresnahan, Director of Advocacy for ARP Maryland. You have my written testimony. We thank Senator Elfreth for putting this bill in and recognizing that this is a disease that needs to be looked at and to have researchers be able to synthesize that data. If you all get our magazine, I don't know if you're old enough yet or not, but you will have seen Michael J.
Senator
Fox.
Augustine's birthday's today, so wherever he is, he's inching a little closer.
You'll see Michael J. Fox. We were featured on our AARP magazine. I believe it was in November. We have done many, many webinars with the Michael J. Fox Foundation to address the issues around brain. We are so concerned about the brain health in that our foundation, we've created a brain health and have designated $60 million in 2 years ago to Alzheimer's awareness and disease development. So we're serious about brain health. Most of our members are serious about brain health. And we are concerned with diseases like Parkinson's that take the ability of someone to function in a regular way. So we applaud the senator, and we applaud you, and we ask for a favorable report of Senate Bill 740.
Okay, thank you. We're going to go next to Mr. Zarzecki, who this committee knows was a poster, basically a great spokesman. We were discussing the Drug Affordability Board, and you were here all the time, and I saw you all over the social media as a great advocate of that. So welcome back, Larry, and you're playing cleanup.
Thank you, sir. I'd like to start by saying my name's Larry Zarzecki, and I would like to thank Chair Kelly, the entire Senate Finance Committee, and I'm really going to try to make this fast. I truly am, for the opportunity to testify in support of State Bill 740. A Parkinson's disease registry just makes sense. Parkinson's disease is, I have just totally had a Parkinson's moment. A Parkinson's disease registry will be so helpful in estimating cases of not only Parkinson's, but dementia, Alzheimer's, multiple system atrophy. So many different parts of the body are affected by this disease. It will help with trends, following trends. It will help with healthcare costs, knowing what's trending. I'm just going to finish this up by saying a registry for Maryland would help us better understand the depth and scope of the disease. Thank you for allowing me to testify, and I ask for a favorable report on Senate Bill 740. Thank you very much for your
testimony.
patience.
Any questions for any of the panelists? Okay, seeing none, thank you, Senator Elfreth, and thank you to the panel. That concludes the bill hearing on Senate Bill 740. We're going to next move to Senator Bidle, Senate Bill 804.
Mr. Vice Chair, can I bring up my panel?
Yes, so your panelists signed up are Aaron Greenfield, Ray Fisher, and Allison Sorborowski.
There you go. I didn't see you. Thank you, Mr. Vice Chair and members of the committee. For the record, Pam Bidle. Senate Bill 804 is the Continuing Care at Home Certificate of Need exemption, elimination of execution of a required number of agreements and corresponding deposits. Boy, I get these bills with these long names. But thank you for the opportunity to present Senate Bill 804. Recently, AARP conducted a survey and found that more than 90% of older adults wish to remain in their homes as they age. Unfortunately, individuals do not always have access to the supports and services that would allow them to remain in their home. This is the focus of Continuing Care at Home, a coordinated long-term care plan for healthy, independent seniors who want to stay at home. I think many of you know, my dad is 94 the end of the month, and we keep him at home. And you need a lot of services. It takes a lot to keep an elderly person at home, even if they're not really ill. But CCAH is growing in popularity across the country. There are 37 programs nationwide, with 5 in PA and 4 in Virginia. It's a more affordable option compared to moving in traditional continuing care retirement community. This would allow greater access to older Marylanders and a variety of socioeconomic groups. Typically, subscribers pay a one-time membership fee. A 75-year-old might expect to pay $26,000 to $66,000 to join, and then between $400 and $600 monthly. In return, they receive services such as care coordination, home health aides, home assessment, companions, living companion, home health aide, assisted living medication management, and if needed, assisted living or skilled nursing care. Senate Bill 804 will help eliminate barriers and expand the availability of continuing care programs to more Marylanders, allowing them to age in place at home. Our current Certificate of Need laws would not allow CCAH subscribers to access beds at a CCRC's assisted living or skilled nursing facilities. Senate Bill 804 will permit CCRCs in Maryland who wish to pursue a CCAH program who have CON-excluded beds to be able to offer subscribers access to skilled care on their own campus. I respectfully request a favorable report on Senate Bill 804. Thank you.
Okay, any questions for Senator Bidle before we move to the panel? Okay, seeing none. Mr. Greenfield, why don't you lead off?
Thank you, Mr. Chair, Mr. Vice Chairman, members of the committee. Aaron Greenfield here on behalf of Leading Age Maryland. We are in support. You have our written testimony. I want to first thank the Department of Aging and the Maryland Healthcare Commission, in particular, Ben Steffen. It's a Mr. Steffen appreciation party today, along with Senator Beidel for her sponsorship. For some time, Leading Age has worked with the Department of Aging and the Maryland Healthcare Commission to determine whether existing law permits a closed certificate of need at a CCRC, the ability to provide a continuing care at home program. And after much research and review of the existing law, Mr. Steffen wrote a letter that basically suggested, or did suggest, that the statutes are silent and it's not clear, and that this legislation would fix that lack of clarity. You have a copy of Mr. Steffen's letter in your file. And as the sponsor mentioned, continuing care at home is growing in popularity around the country. There are 37 nationally, 5 in Pennsylvania, 4 in Virginia, and they provide coordinated long-term care to independent seniors who want to stay at home. We also know that after us, you'll hear from Arnold Epple from the Wesley with suggested amendments, which we are supportive of, and I understand Secretary Kramer, we had a conversation with her, and she too is supportive of those amendments. But with me and at my request are Allison Siborowski, President and CEO of Leading Age Maryland, along with Ray Fisher, President and CEO of Ginger Cove, which is here in Annapolis, who will speak further to the importance of this bill. Thank you.
Okay, thank you. We'll go next to you, Ms. Siborowski, and then we'll finish up with Mr. Fisher.
Thank you, Mr. Vice Chair, members of the committee. It's a pleasure to be here today with you. I'm Allison Siborowski, President and CEO of Leading Age Maryland, here to request a favorable report of Senate Bill 804. Thank you so much to Senator Beidel for her support of this legislation. Leading Age Maryland is a community of about 140 not-for-profit aging services providers in the state. So we represent CCRC life plan communities, affordable senior housing, hospice, home care, and we partner with groups that care about aging in Maryland. And our goal is really to make Maryland a better place to grow old. So in short, this bill will support the expansion of the continuing care at home model in Maryland. All of us want to be able to make choices about where and how we age and what kind of care we take advantage of. And this program offers older adults the assurance and peace of mind knowing that they have guaranteed lifetime access to a wide range of health care should their health needs ever change. In a moment, you're going to hear from 2 of our members, Ginger Cove and the Wesley at Home. And so I'm going to cut my comments short because I know you've had a long day, but we request a favorable report for Senate Bill 804. Thank you.
Thank you. Mr. Fisher?
Thank you, Senator Beidel, Mr. Vice Chair, and members of the committee. I'm Ray Fisher, the CEO of Annapolis Life Care, doing business as Ginger Cove, a nonprofit continuing care retirement community located in Annapolis, which serves over 350 resident members. My perspective is unique, as in 2018, as Chief Operating Officer of LifeSpire Virginia, a faith-based nonprofit system of 5 CCRCs located throughout Virginia, I, along with my team, implemented a continuing care at-home model under our Lakewood CCRC. This was done as I was struggling with several key strategic challenges. How to expand our mission by serving more seniors, as over 85% of seniors want to remain at home as they age. How to provide an alternative to the capital-intensive bricks and mortar solution for our seniors, a solution which has been a key component as well as a key constraint of the CCRC model. How to create an affordable product which would enable us to serve more seniors by appealing to a broader socioeconomic demographic. And how to increase choice and options for seniors so they are able, in fact, to live their best lives. I found the solution through the creation of a continuing care at-home program. This program provided the following for seniors in Virginia: a personal care coordinator who performed or coordinated the following services through proactive engagement: a baseline assessment of the resident member's home to ensure it's appropriate for their ambulation and related activities, arrangement of in-home and out-of-home services, nutritional wellness advice, and assessments. Our program exceeded expectations by growing to over 70 residents members within 12 months. It is important to note that Ginger Cove engaged Spring Choice Consulting performed a survey of our market.
You can finish up.
Thank you, please. I appreciate that. Which comprises 21 zip codes. They have identified a current and growing market of over 33,000 age and income qualified households. That's 40% in excess of what we need to succeed in this program in our marketplace. Passage of this bill will enable Ginger Cove and other CCRCs across Maryland to leverage their brand recognition and expand their mission by serving more seniors, expand choice for seniors in Maryland, improve the quality of life for seniors in a multidimensional sense as they age through body, mind, and spirit engagement, lower the stress level for our seniors and their families by appropriate and early interventions, which reduces the crisis which results from a change in health and function, reduce financial and business risk for the sponsoring CCRC through revenue diversification and reduced reliance upon home sales and the related volatility.
Mr. Fisher, yeah, just maybe you could,
Okay.
kind of bring it to some closure.
Let me give you one last paragraph, okay? 10 seconds. In closing, as my grandmother told me, son, let me tell you, aging is not for sissies. When I asked why, she said, because it's tough to face the challenge alone. By passing this bill, you will help many Maryland seniors to never go it alone. I've seen firsthand the positive impact this program has had and continues to have to Virginia seniors and their families. Our Maryland seniors need and deserve the same opportunity. Thank you.
Okay, thank you, Mr. Fisher. Any questions for the panel? I've got Senator Kramer.
Thank you, Mr. Chair. And I just want to say, Senator Bidle, this is a great bill. I'm not sure how we didn't get here far sooner, but to be able to change the model to help our seniors age in place is a win-win for everybody. And I note that my friend Aaron Greenfield mentioned there's going to be a couple of amendments coming, and they really do make the bill clean, sharp, workable, and thank you for that. Good bill.
Thank you very much. And there are amendments coming, Senator. And one of them is from someone you know, the Secretary of Aging would like a July 1st effective date. So that will be one of the amendments. Thank you.
Makes sense. Thank you.
Okay, well, we have a lot, we have a lot of respect for Secretary Kramer.
We do.
Also Senator Kramer.
Not as much for the senator, but for the secretary.
Thank you.
Okay, so we only, speaking of amendments, we do have one final witness, Arnold Appel, favorable with amendments. So, Mr. Appel, why don't you come up and tell us about what amendments you have?
So I'm the first one that can say good evening. It's after 5. Vice Chair, members of the committee, thank you for having me. Senator Bidle, thanks for supporting this with amendments. My name is Arnold Appel. I'm the Executive Director for the Wesley Incorporated, a nonprofit, which has the only preliminary certificate of registration in our state of Maryland for a continuing care at home program. There are 37 of these nationally, not one in Maryland, except we were approved for a preliminary certificate in December of 2021. The history of the continuing care at home program in Maryland has been in 2002, and I was available and working at Baltimore County Department of Aging, was the program failed miserably. The reason why is it couldn't get out a pre-sales requirement. Pre-sales requirement is a big factor in not allowing this program to grow fast, not allowing the program to grow at all in many cases. The daily benefit that is out there is paying for long-term care benefits, which is going to take folks that are self-fund their long-term care and keep them off of Medicaid. That's the most important part, as we all know. In nursing homes, you end up in Medicaid. Currently, 95% of people nationally never go into a nursing home in this program. They're seen throughout the home, and most of the services are rendered at home. There are the pre-sale requirement, the CON, or the barriers. Currently, there's a $500,000 reserve, a capital reserve of 15% of operating reserve, and a contract reserve that's required in this program. Delaware, New Jersey, Ohio, Pennsylvania, and Virginia have no reserve requirements. New York has 15% operating. Maryland has all three of the capital reserves. Kendall, a program in Ohio, has elected to go to Massachusetts, not in Maryland, because of the barriers that Maryland has set up. We appreciate your looking at this bill with the amendments. The amendments are as important as the bill. This is self-funded long-term care for older adults that they pay their own. Our program offers $350, $280, and $175 lifetime daily benefit for long-term care. It's only available currently in Baltimore County and Baltimore City. That's the area that we're concentrating on. Thank you. I appreciate a favorable report and your approval with the amendments.
Okay, thank you, Mr. Eppel. Any questions for our witness? Seeing none, that concludes the bill hearing on Senate Bill 804.
Thank you.
We're going to next move to Senator Klossmeyer, Senate Bill 828. And I will call up your panel, Lisa Klingenmeyer, Kendra James, and Michelle Medeo.
All set.
Okay, you've got the floor, Senator Klossmeyer.
Thank you, Mr. Chair. Senate Bill 828, Family Investment Program, Eligibility, Work Experience, Community Service, and Reports Alterations. Maryland's Temporary Assistance for Needy Families, TANF program, commonly called Temporary Cash Assistance, or TCA, is the only program in Maryland that provides direct cash assistance to low-income families with children. Cash assistance helps a family meet basic needs with experiencing a crisis and improves the health and education outcomes of children experiencing poverty. Federal law establishes a mandatory work requirement for able-bodied parents who receive the TCA. As TANF is a block grant, the federal framework is flexible and allows states to be innovative in how they administer their programs. Parents who participate in the work program want to acquire substantive training and skills while on TCA so they can find higher-paying jobs than they had before they entered the program. 60% of the TCA adult recipients in Maryland work right before they receive TCA, but data shows the work program in Maryland is not improving TCA recipients' employment outcomes. Almost 68% of former TCA recipients are living in deep poverty 5 years after they receive TCA, and 80% of these families still live in poverty overall. Senate Bill 828, using federally allowed flexibilities, makes several changes to the workforce component of TCA, recognizing that parents have a wide range of personal experiences, history in the workforce, and family structures that are ill-served by one-size-fits-all work program. I'm going to go through the bill and its four main parts, and my sponsor panel can let you all know more additional details, and they're happy to answer questions when the time comes. The first part of the bill is about reforming unpaid work experience to improve skills and employability and earnings. Maryland is an outlier in its overuse of work experience category, which is one of the 12 categories of the federally allowed work activities, and generally has the worst outcomes. Nearly 30% of all work-eligible families who receive TCA in Maryland are participating in unpaid work experience. Meanwhile, most states don't use this category at all, or less than 2% of the cases. After leaving TCA, only 1 in 2 families in Maryland who do the unpaid work experience are able to find a job, often the same low-paying, unstable jobs that often led them to TCA in the first place. At the same time, hundreds of employers throughout Maryland benefit from the labor TCA in the work experience placement, including large employers, small private companies, and even our own state government agencies. The vast majority of employers never hire participants such that in the last 4 years, less than 100 TCA participants in unworked work experience gained unemployment through their placement. Senate Bill 828 reforms the unpaid work experience program in Maryland to ensure that when it is used in its operating consistent with the federally stated purpose to help TCA participants find paid employment. Senate Bill 828 will do this by providing participants with marketable skills necessary to obtain employment in local high-growth industries, increasing the number of TCA participants who are hired for employment by unpaid work experience employers, limiting the use of unpaid work experience to one 90-day placement in a 3-year period, and offering families 3 work activity options and allowing the family to choose their placement, and creating annual reports, which is very important, on Maryland's use of unpaid work experience available to the public. Second part of the bill is to enable parents of children under 1 year old to exempt from work. Federal law allows a parent to be exempt from work when needed to care for an infant under 1 year of age. Currently, Maryland caps this exemption to 12 months in the parent's lifetime, which means the parent already used the exemption for one infant in the past. The parent would not have the choice to be exempt if needed to care for another infant in the future. Senate Bill 828 lifts the 12 months exemption and allows parents who have a second child to opt to take the time to be with their baby. New parents can still choose to work. This change to the law simply allows parents of infants the choice to work out of the home or to work and care for their newborn. Many parents need time to recover from childbirth, establish a feeding schedule, take care of mental health, postpartum needs, and want time to bond with their babies. Without this flexibility and choice, the work requirement often forces families to use whatever care is available for the hours needed, and many families do not have the access to high-quality child care. Part 3 is adopt a federal 30-hour minimum work week, 20 for single parents with a child under 6. Federal law allows families to be considered engaged in work if they are working 30 hours a week generally. In Maryland, the state instead has been using a 40-hour work week as a standard mandatory time. Senate Bill 828 establishes 30 hours as the minimum of work week, giving parents the choice of working anywhere 30 to 40 hours per week instead of mandating 40 hours. The majority of states allow these minimums, including all of Maryland's neighboring states. This flexibility will allow many parents to engage in the work program who otherwise might need to choose between an exemption if they cannot do the 40 hours. For example, if they are needed to pick up their children from the school bus or want to assist their children in completing their homework. Part 4, giving families the choice of exemption from work for the first 12 months of TCA. Federal law allows states flexibility to exempt families for the first 24 months on TCA. While Maryland has a list of specific exemptions from the work requirement, there is more flexibility allowed within the federal framework. This bill is offering families the choice of 12 months exemption, even though federal law allows up to 24 months. This is how Maryland used to administer its work program in the 1990s after welfare reform. Many families are experiencing profound trauma and destabilization situations when entering TCA and may need some flexibility and support to stabilize before immediately entering the workforce. Giving families time to stabilize before moving into the workforce requirement is trauma-informed approach. Senate Bill 828 is an optional exemption for up to 12 months when a family enrolls in TCA and will allow families to have more economic stability which positively impacts outcomes for children because their family's income will not be disrupted. Also, we are actively working with DHS to address the concerns they raise. The department has noted that they believe the reporting section of the bill will make it more difficult for them to demonstrate that they are meeting federal work participation rates, WRP. While other states do this, Maryland has consistently exceeded WPR, and every year there is available data, so we are not concerned Maryland would ever be penalized of our WPR. However, in effort to be responsive to the department, we are open to amending the bill to remove this section. Taken together, Senate Bill 828 aims to improve the workforce components of the TCA, creating a series of changes that are allowed under the federal law to move Maryland's TCA program in the right direction, affirms the dignity of families and increases their economic mobility. Senate Bill 828 allows families more choice in the work program, encourages Maryland to be innovative and evidence-based programs that would significantly improve parents' employment and earning outcomes. This bill has the support of Black and Women Caucuses, and the committee, I asked the committee for a favorable report. And it just goes to show that working with the federal government sometimes gets very, very complicated, and this bill shows that. So I'm hoping by this bill we'll be able to streamline things and make it much better and get better outcomes for people when they're working and trying to make a living and get better jobs. So with that, I'm going to let the panel take over, and I'll sit down.
Okay, any questions quickly for Senator Klossmar before we turn it over to the panel? Seeing none, so we'll go to, first to Ms. Klingemeyer, and then we'll just go down and we'll wait till everybody testifies, then we'll take questions. Okay, Ms. Klingemeyer.
Thank you, Mr. Vice Chair, Madam Chair, members of the committee. My name is Lisa Klingenmeyer. I'm here today representing Welfare Advocates, which is a coalition that advocates for a strong safety net and for programs that advance families to economic stability. We're here today in strong support of Senate Bill 828. As our sponsor mentioned, temporary cash assistance is the only program for low-income children and their caretakers in the state. It comes out of the federal TANF block grant, and because it's a block grant, states have wide flexibilities in how we implement the TANF program. And essentially, in short, what this bill tries to do is take advantage of those federal flexibilities. It implements things other states are doing across the country that have been found to be more client-centered and more trauma-informed, and implements those in our state. The work requirement is federally mandated, but there's many options states have for how adults on TCA meet that work requirement. And so what this bill really tries to do is create tangible changes today that allow families to have more choice and flexibility as they're navigating the situation they find themselves in where they need TCA, whatever brought them to temporary cash assistance. After me is going to be a parent who will share her experience with you, so I don't want to go into the work requirements too much, but I do want to mention we strongly believe this is a good bill with no fiscal note that will not jeopardize our work participation rate at all. I do know that there is a letter of concern from the department. I'm happy to address that in more detail if anyone has questions, but we firmly believe that this is not a concern. The Federal Department of Health and Human Services issuing guidance to states actually states that they give guidance to states on work participation rates because they want states to have as much flexibility as possible to implement effective, innovative, and creative programs that support work. The federal government wants states to try things, to see what's going to work, to see what might help families advance to jobs that have good wages, stable hours, and that can build economic security. The federal government has wide options for states to meet work participation rates. Maryland has implemented several changes to temporary cash assistance over the years, and the department has often brought up work participation rates as a concern, but those have never come to fruition. Maryland has never not met our work participation rate. Even in a future scenario where perhaps we would not, the federal government has several different steps and opportunities for Maryland to correct before we would ever be in jeopardy of losing $1 of our TANF block grant. So we strongly believe this is a good bill with no fiscal note, that it's going to make a difference in the lives of TCA parents, and I'll yield the remainder of my time. We urge a favorable report. Thank you.
Thank you. We're going to go next, excuse me, to Kendra James. And we didn't have the clock on. We're supposed to be under a 2-minute rule here. So Ms. James, you're next, and then we'll go to our final witness on this panel, and then we'll take questions. Ms. James.
Thank you. Thank you, Vice Chair and Madam Chair, for this opportunity to share my testimony and lived experience in the TCA program with you all. When I first
Why don't
moved.
you pull, if you could pull that a little closer, because.
Is that better?
Yeah, much better.
Okay. When I came to TCA, hello. When I came to TCA, when I came to Baltimore, I was in a crisis situation. We were in a shelter and needed a lot of help and resources. And I was met with a lot of questions such as, well, you're from North Carolina, why'd you move to Baltimore? The most honest answer to that question, excuse me, is the fact that Baltimore offers a lot of resources that the little southern town I came from did not. Such as housing programs and TANF and welfare. It's not offered in the way that it is in Baltimore. So that's why I came here. Once I got here, TCA said that you have to be in this work program, and if not, you're going to lose your benefits. Well, I was living in a shelter. I have a 10-year-old and a 14-year-old child at the time. My 10-year-old was covered by a voucher. My 14-year-old was not. However, the policies in the shelter say your child cannot be left alone or unattended for any reason at any time, nor do they encourage these children being left with another shelter resident, possibly a stranger, and why would you want to do that anyways? So the shelter provided summer camp through, and it was free. Summer camp hours was 8 to 4. I found a program through Goodwill that was 9 to 2. Social services told me that they couldn't tell me not to go to the program, but it would not save my services, that my case would be terminated because DSS does not sister with Goodwill, and those classes are not accepted. I'm not ever looking for a handout, just a hand up, just asking for a strong leg to stand on so that we can build the security that we need for our families, not just today, but in the future. That class at Goodwill would have helped me tremendously.
Okay, well, thank you. I appreciate your testimony. We're next going to go to Michelle Medeo, and you've got 2 minutes.
Thank you. Good evening. Michelle Medeo. I'm an attorney with Homeless Persons Representation Project. I direct our Economic Justice Project, and I've worked with hundreds of families over the 9 years I've worked there. My organization has been doing this since welfare reform, so the last 25 years. We've worked with so many people who have been negatively impacted by the program. So I really want to highlight this unpaid work experience and how problematic it is. Maryland refers 30% of work-eligible families in the TCA program to this unpaid work experience. So what that is people in exchange for TCA are working 20 to 40 hours a week at an employer, performing everything from mopping floors, cleaning toilets, filing, you name it. And these are employers that can afford to hire folks. There are places where, I get my Impossible Burger, my cheeseburger, you get your package 2 days from now. Big employers, they're state agencies. Small employers, it's all over Maryland. Unfortunately, the data shows less than 1% of the employers actually hire folks who are doing this work. So the program's not working. It's allowed by federal law as long as it provides folks with skills and turns into paid employment. That's the whole purpose. That's not what's happening. Maryland's an outlier. Nearly all other states have abandoned this program and don't use it because the data is very clear that it doesn't work. And so SB 828 ensures that when unpaid work experience is used, it's used as intended by federal law. Maryland's WPR will not be impacted because they can still refer folks to this with the limitations, and there's 11 other categories of work options that Maryland can choose from. I want to lift up the fact that a lot of parents with lived experience was part of the design of this bill. The recommendations came from them.
There are some folks who submitted very powerful written testimony. I encourage you all to take a look and please consider that and vote in favor of SB 828. Thank you.
Okay, thank you. Any questions for any of the three panelists? Senator Benson.
To the lady that spoke here, what's happened to you now? Where are you now?
Where am I now? I'm sorry. Now I am in a government-funded house, living, working towards self-sufficiency. Not quite, just yet. The pandemic had a lot to do with that, so it's hard working with TCA right now because there's not a whole lot of communication. And the communications that has been put in place since the pandemic, a whole lot of times don't work. My DHR does not work. All of the email correspondence and all of that stuff with my worker and everything else isn't working. So right now, my situation has, taken a 180. I'm no longer homeless. I am in stable housing, and striving.
You say that again?
I said, and striving, trying to make it through every day, doing the things that I have to do in order to keep all of my benefits that I have, as well as doing the things that I need to do for my own health and my own mental and physical health, because this has been a ride.
The only income that you get right now is what?
Is TCA.
That's your only income. Have you been able to move from a shelter? You say you now have a home?
Yes, ma'am.
And you have children?
Yes, ma'am. I have 2 children in the home, ages right now 14 and 16. Whenever we were in the shelter, they were 10 and 14. So when being in the shelter with the shelter policies being what they were, there was no place for my 14-year-old.
I know. Yeah. This bill's so important. Okay, thank you.
Yes, ma'am, it is.
Thank you very much.
Thank you.
Any additional questions for this panel? Senator Klausmeyer.
Yeah, Lisa, you said something about the letter from the department. Can you very, very briefly touch on that and say what?
Yes, absolutely. So the letter from the department is a letter of concern. They note that they're particularly worried about the work participation rate. One thing they mention is that they did not meet their work participation rate in fiscal year 2021. That's because no state met their work participation rate because we were in a pandemic. So the federal government's already told states that they're going to give wide discretion for reasonable cause, so no state's going to be penalized for not meeting that during a pandemic. They're also concerned because one provision of the bill said that we were going to restrict what activities we would allow them to count towards work participation, and that is the section that our sponsor said we're willing to amend out. The other provisions we don't believe will impact work participation, and even if some unforeseen circumstance they did, there is a release clause in the bill that would allow them to revert to go back to previous changes if we were ever in jeopardy of losing that. So we don't believe that there is a concern for work participation rate.
Thank you.
Yeah, just real quick, I was talking to council. What specific section are you referring to?
I think it's what starts at the end of page 4 and goes into page 5, but Michelle is the one who's written the amendment, so she would probably know that better.
Do you have your own okay. What amendments are we talking about? You have amendments you've submitted to the committee, or you're
So our delegate in the House who co-sponsored the cross-file, we were working with her to put together some amendments that we will be able to submit to our sponsor in the Senate.
Okay, that's
Yeah.
fine.
Sponsor will get them from
Yeah.
cross-file.
Okay, well, we cleared that up. Any other questions for any of the witnesses? Seeing none, we have thank you very much for your testimony. We've got 2 more witnesses on the bill, Alexis Villegas and Callie Schumitz. Both signed up favorable. Okay, either one, just start.
Go ahead.
Tell us your name.
Okay.
You got 2 minutes.
Okay, sorry. Good afternoon. My name is Alexis Villegas. I'm a third-year law student with the University of Baltimore, and I'm a student attorney with our Civil Advocacy Clinic representing low-income individuals. The clinic strongly supports this bill as it'll positively affect many of those that we represent. I'm here today to speak with you specifically about two provisions of the bill, namely the change to the minimum work hour requirements and the improvements to the unpaid work experience program. First, we conducted extensive research of the TANF laws in all 50 states and DC. And what we found was pretty surprising, but supports much of what you've heard today, that Maryland is only one of 5 states that has the 40-hour requirement. Federal law, the minimums are lower. This bill puts Maryland in line with the federal minimums. And this is important because TCA participants, parents, the vast majority of them are young women, are single women with young children living in deep poverty. And they often face significant barriers like unreliable childcare, lack of stable housing, health issues. And we have to, by making these changes, we actually will be providing some flexibility to parents to not only work towards economic success, but also care for their children. And this provision alone isn't enough. The bill provides for other provisions that are critical improvements, namely those applicable to the unpaid work experience. Maryland uses WEX, unpaid work experience, at a rate of about more than a quarter of parents are enrolled. Apologies. And that's a rate higher than 45 other states and DC. We are a significant outlier. However, the research indicates that this use leads to lower rates of long-term employment and lower wages. And many of these parents placed in these positions end up returning to deep poverty once their benefits end. So this bill, these changes aren't just beneficial for the recipients and their families, they're good for the economy of Maryland and will increase efficiency. Thank you.
Okay, thank you, Ms. Schumets.
Thank you, Mr. Vice Chair, Madam Chair, members of the committee, and thank you to Senator Klossmeyer, who did a very thorough job explaining all the aspects of this bill. My name is Callie Schumets. I'm with the Maryland Center on Economic Policy, here in strong support of Senate Bill 828. I will strongly echo all the remarks of the prior speakers. I'm going to focus kind of on some of the economic benefits of the temporary cash assistance program. As we've been talking about today, TCA provides economic lifeline to families with children who have very low incomes. Cash assistance is flexible. It allows families to address whatever their needs are in the moment, whether that's helping with rent, buying clothes, school supplies for the children, paying utility bills. And that economic stability is not only important for that family, but also benefits their communities, their local businesses. And reducing childhood poverty in particular has a wide range of well-documented lifelong benefits for health, education, and earnings later in life. That's why making the workforce participation portion of the TCA program more effective for the participants will create long-term economic benefits as well. In particular, as prior speakers have outlined, it's really critical that we reform this unpaid work experience program because the data show that these placements almost never lead to a paying job and don't equip participants with skills that are useful in the workforce. Similarly, there is no benefit to pushing people into work programs while they're trying to recover from a major life upheaval or pushing people into a work schedule that doesn't recognize or accommodate their family caregiving needs. This legislation would help provide additional flexibility. Making sure the TCA program is better able to meet the distinct needs of families will improve outcomes for those families and ultimately strengthen our communities and our economy. So we'd ask for a favorable report. Thank you.
Okay, thank you. Any questions for the witnesses? Okay, seeing that, that concludes the bill hearing on Senate Bill 828. You want me to give it back to you? And with that, I'll.
Thank you. We're going next to Senate Bill 829, Senator Klossmeyer, Department of Human Resources Family Investment Program Contract and Program Review. And let's get up your initial.
You want to get the panel up?
Yes,
I think there's three.
Klingenmeyer, Kelly Schmitz, Michelle Mandel.
Senate Bill 829, Department of Human Services Family Investment Program, Contract and Program Review. Maryland's Temporary Assistance for Needy Families, TANF program, commonly called Temporary Cash Assistance, or TCA, is the only program in Maryland that provides direct cash assistance to low-income families with children. Cash assistance helps a family meet basic needs when experiencing a crisis and improves the health and education outcomes of children experiencing poverty. While TCA is a critical safety net for those living in the deepest levels of poverty, it is not a pathway to economic stability for the vast majority of recipients. In order to receive TCA, able-bodied adults in the household are required to participate in federally defined work activities. Although the original intent for the work requirement might have been for recipients to obtain employment after a short spell of receiving benefits, numerous studies show the workforce component of cash assistance does not result in long-term stable employment. Data shows that participants in the TCA work programs are not finding any kind of high-quality jobs, high-wage jobs when exiting the TCA programs, and instead continue to live in poverty for years after leaving TCA. Senate Bill 829 aims to improve this program by requiring DHS to hire an outside consultant to review Maryland's TCA program and make suggestions on how the program can be improved. This bill will create a one-time comprehensive review of the TCA program by an experienced outside consultant who will assess the TCA program to review how the department can implement policies equitably and employ practices to achieve the best outcomes for children and their parents. Senate Bill 829 will also improve the vendor contracts that DHS uses to administer its TCA work programs. Currently, Maryland spends $30 million annually in TCA work activities. Each DHS vendor contract ranges from $100,000 to over $4 million. The contracts focus on the number of people enrolled with little incentive or oversight of the performance of the vendor. And I think that's very important to note. Very little incentive or oversight on the performance of the vendor. Senate Bill 829 will increase economic mobility by requiring vendors to contract to be perform-based. The review of these contracts must measure overall program impact, the progress towards employment for the participants, and employment outcomes for family who left TCA for unsubsidized work. Improving the vendor contracts should improve the quality of the work activity programs, the skills and experiences, which are very important, of parents who participate, and overall employment outcomes for families that receive TCA. I thank the committee for their consideration, and I'm requesting a favorable report. And I think this program should be modified and changed and do its right work. Thank you.
Thank you. All right, each of you has 2 minutes each, and the mics are movable. You may go ahead in any order that you would like.
Thank you, Madam Chair, Mr. Vice Chair, members of the committee. Again, Lisa Klingenmeyer here today representing Welfare Advocates. We're here today in strong support of Senate Bill 829. Our previous Bill 828 was essentially looking at what are some short-term fixes we can make today to make TCA better for parents who receive it. What this bill is asking is for us to have a longer-term vision of what kind of program do we truly want temporary cash assistance to be. How do we want this program to function? What are we hoping families get out of it? And what are we looking for in our communities? I think a lot of us probably share a goal of we want temporary cash assistance to be there when families are in crisis, give parents time to stabilize, and then allow the program to provide them with opportunities for tangible, marketable job training programs, skill training programs so that they can find employment that's meaningful and that builds economic security and centers the family's goals. And that's what this bill's trying to do. It requires the department to hire an outside expert who's done this in other states, and several other states have done this kind of review, to take a look at our program, which has largely been unchanged in the past 25 years. So this is a really good opportunity, as we have a budget surplus, we have a TANF surplus, to take some time to examine our program, ask ourselves what kind of goals do we want, and also to center the lived expertise of those who have and been on temporary cash assistance. This bill requires the person conducting the study to consult with folks who have been on the program and center that expertise. So our goal here really is trying to figure out how can we build this program so it truly supports families, supports our communities, and then ultimately supports our state and our economy. We strongly encourage a favorable report, and thank you for your time.
Thank you. All right.
Thank you, Madam Chair, Mr. Vice Chair, and members of the committee. Once again, my name is Callie Shumitz. I'm with the Maryland Center on Economic Policy. And as an organization that uses research to advance policies that allow all Marylanders to thrive and support a healthy economy, we really understand the value of good data and good information when making sure that programs, the state programs are benefiting people and doing what we're hoping that they will do. So that's why we're here in support of Senate Bill 829.
Thank you very much.
Sorry, just one more minute.
Go ahead, take your time.
Well, the federal TANF program has flaws that ultimately can only be addressed by Congress. Maryland does still have significant flexibility in how it administers the program, and there's room for improvement. The data that we do have now makes it clear that TCA's workforce programs are not leading to good outcomes for most parents who receive cash assistance, as we've been discussing. So the study called for in this bill will help us identify what's working, what's not working, and what we can do differently, maybe what's worked well in other states, to improve outcomes for families participating in TCA, because that's what we really care about at the end of the day. And then further, this bill would help ensure that state resources are being used as effectively as possible by creating some basic quality standards for the businesses and nonprofits that the state contracts with to administer these programs. So we would ask for a favorable report. Thank you.
Okay. Thank you very much. Are there any questions? Yes.
I think this is one more.
Okay. All right. Okay, go ahead. Are
Good.
you Kelly?
Michelle Medeo. with-
Okay,
Thank
fine.
you. Michelle Medeo with Homeless Persons Representation Project. TCA in Maryland, the federal program TANF, it's pretty widely acknowledged that this program is rooted in a lot of false stereotypes and racism, and the history that, several years ago led to the program today. Some of these policies are still lingering today. And so this is why hiring an outside consultant to conduct a review through an anti-racist lens to make sure that the policies that still are today are not only best practices, but also carried out in an anti-racist way, trauma-informed way. A lot of the parents who come to apply for TCA are experiencing profound trauma. So it's really important the communication with folks is through a trauma-informed lens. From policies down to, the communication when you walk in the door. So number of states and cities have already done this kind of consulting work and had great outcomes. Just to list a few: Vermont, Louisiana, Maine, Massachusetts, Michigan, California, Pennsylvania, Oregon, New York City. So it's time Maryland joins the club and does the review. SB 829 also looks at the design of the vendor contracts. Currently, Maryland's contracts focus heavily on the number of people enrolled in the program. There's very little focus on what actually happens when you get there, what jobs folks are getting. You've heard a lot today. Folks are still living in deep poverty 3, 4, 5 years after they exit TCA. So we want folks to be having, when they exit TCA, livable wages so they can afford rent and they don't have to cycle back onto TCA. No one wants that. DC, other places have done a redesign of the vendor contracts. DC did this, and they noticed very shortly after a tenfold increase in the share of TANF recipients who were engaged in work after they redesigned their contracts. So we know it works. We request a favorable report on SB 829. Thank you.
Thank you. Thanks to all of you. Are there any questions? All right, Senator Hayes and Vice Chair Feldman.
Got you. Thank you, Madam Chair. As I was reading the bill, I kind of had some of the same questions that was articulated in the agency's letter. I think I agree with you. It probably need to be an independent evaluation to see what the best practices are. But it seems like in the legislation, you guys have outlined the measures prior to investigating what are the best practices nationally, as opposed to doing a study, getting back the information, and then coming back to implement those. Have you guys had a chance to read the agency's letter, and what do you think about putting the cart before the horse, so to say?
Yeah, that's a great question. I mean, we have talked to the department before the bill hearing. I think one of the things we were trying to do is this language does model what a lot of the other states have studied in the way that they've ran their investigations and reviews of their program. I think what the department's articulating is that right now, to the federal government, a lot of times what matters to them is work participation rate. And so they want to make sure that.
That was the second part of the question, right?
Yeah, and so they want to make sure that that's a component. And I think what we've seen in other states is once you've redesigned the program so that parents are getting into better placements with higher wages, your work participation automatically goes up because parents are getting the skills that they want, they're getting hours that fits their schedules, and so most states who've implemented this without having to focus on WPR, their WPR went up. And I think what we're trying to do with this study is to sort of also move the conversation outside of, when we think of what's successful, is it just WPR or is it wages, is it stability, is it flexibility? So we're still obviously open, and we've been talking, the department in particular, I think is very interested in this, so we are, open to figuring out exactly how that study is modeled, but we want to make sure it's not just solely focused on increasing WPR alone, because we want to make sure that we are talking about, how we build this long-term stability, because focusing on WPR up to this point hasn't brought us this sort of larger economic security I think we're looking for.
Right, no, and I get that, but it is the one measure that the federal government decides on how much we as a state can receive. And I would imagine if you put it in the law to give guidance, because it sounds like we're directing through statute a contract, right? And so if we're going to provide some direction, the baseline should be the measure by which we're funded as a state. Wouldn't you agree?
Yeah, again, I mean, I think we're happy to, talk about how to add that component in to make sure that it's covered in the review.
Gotcha. Thank you, Madam Chair.
Let me just follow up. So if I'm understanding your response to the senator, you really want not only to do what obviously you got to do if you're trying to improve, that is to be sure you're living up to the standards in the current program. But if the program is not giving you good outcomes and people aren't getting into good job placements, if they have many impediments now which prevent their child caring responsibilities and their work-related responsibilities, the program needs to change so it works better for the people. Is that what you're saying?
Absolutely. Yes, Madam Chair.
Okay.
Madam Chair?
Yes.
Might I just say, you have been here longer than I've been here, and I don't think anything's been done to this program for years and years and years. It's time to get into the new century.
Right. Okay. Thank you. Any other questions? All right. Thank you very much for your testimony. Okay. All right. Senator Lamb, if you'll come on up, let's see, for Senate Bill 708, Maryland Department of Health Officer of the Inspector General and Emergency Procurement Audits.
I know.
And we could bring up Jessica Ray from the department who will be testifying. Okay.
Could I ask the committee staff to also turn on the overhead?
You're going to need to pull that mic up.
Sure.
Closer to you. Yeah.
All right.
It can come up, I think, higher because, you know.
I'm not that tall, but.
Okay.
Let me see. Oh, there we go. Yep. It's hard to, is this screen good? All right, so while that's coming up, Madam Chair, members of the committee, it's a pleasure to be here to present Bill 708. And for the record, Clarence Lamb, Senator in District 12. So good afternoon, good evening almost. As everyone is aware, the pandemic has presented unprecedented public health challenges for the people of Maryland. And in order to fight the public health crisis, the state had to work to secure critical medical equipment, implement testing, and distribute life-saving vaccines. And while there were many successes, as we've been able to get millions of Marylanders vaccinated in the span of the last 12, 15 months, the effort has also brought to light some significant shortcomings. One of the most glaring concerns pertain to the state's mobile vaccination programs, which carries on to today. As I'll explain, these mobile vaccination programs have generated increasing concerns, specifically with corners being cut, poor oversight and management of emergency contractors employed to administer vaccines, clinical concerns being sidelined, and when a whistleblower, Dr. Ray here, brought these concerns forward, she was demoted and experienced retaliation by the Maryland Department of Health. Let me just start by saying thank you to Dr. Ray for being here. She doesn't have to be here. She doesn't have to blow the whistle on her concerns, but she did the right thing, and by doing so, she had the courage to stand up to voice her concerns publicly when she was receiving no response from her supervisors at MDH. And I want to touch on her background because she will be speaking and because much of her testimony hinges, or much of my testimony rather, hinges on concerns that she has since brought forward. Dr. Jessica Ray has been serving as the department's COVID response and recovery efforts since the pandemic began. First, she started with the Baltimore City Convention Center Field Hospital, then as the Chief Safety Officer for the state's community testing sites. And then in September of 2020, she transitioned to serve as a clinical advisor leading testing operations. In fact, she helped design and stand up the testing tent that's just across the street over here for all of us at the complex. She eventually worked her way up to become the mass vaccination chief clinical advisor. She has a doctorate in health sciences and has been practicing as a physician's assistant for the past 14 years. She's had many publications, including on traumatic brain injury. So I want to begin by being clear on what we are focusing on. This is the MDH's mobile vaccination program. So if you were to rewind the clock back to January of 2021, as the first vaccines became available in the state, the Senate Vaccine Oversight Work Group voiced concerted concerns that led to the creation of the state's mass vaccination sites, which were largely successful in getting tens of thousands of Marylanders vaccinated. As the mass vaccination sites wound down, there was a greater need and increased capacity for MDH to expand its mobile vaccination program, or Mobile Vax, where smaller, sometimes pop-up clinics would be set up in neighborhoods, places of worship, community centers, and bringing the vaccine to the underserved, hard-to-reach, or less mobile populations. These mobile vax clinics were divided up into two types, those operated by companies contracted by MDH to administer the vaccines, as well as, quote, organic clinics that were operated by MDH employees themselves who administered the vaccines to residents. The Mobile Vax program fell within the larger branch known as the department's recovery program, as the slide shows, which had the aim of addressing vaccine and testing gaps in the community. The intent was to help communities in their recovery by providing them state help in testing and vaccination so that the recovery program could eventually wind down its own operations to allow counties to go back on relying on their local health departments and local resources to administer the vaccine and testing and such. However, the program here is that many of the recovery program leadership were contracted employees themselves, and thus what they heard was a goal of saying that they wanted to, quote, stay in business because they had an incentive to see the program continue despite dwindling demand for the vaccines, because as contractors, they would continue to get paid as long as the clinics remained active. Our concern now is that except for very limited circumstances, the need for a broad-scale mobile vax program may have outlived its usefulness, particularly when you consider that the state is spending $10,000 or so per clinic, with sometimes only a dozen or two people being vaccinated at each clinic, all the while a local pharmacy just down the street or around the corner may be offering the same vaccine for free. In other words, the mobile vax program might have made sense when the vaccine supply was limited, but not so much so when the supply is abundant as it is today. Inadequate supply is no longer a reason that people remain unvaccinated. Last year, Dr. Ray first brought a concern regarding vaccines administered by a company called TrueCare 24, who was contracted by the state through a $1.4 million emergency procurement. To summarize, in what has been extensively covered by the Baltimore Sun, Dr. Ray cited concerns of improper handling of the vaccine, specifically that vaccines were kept overnight in hotel rooms and in cars instead of medical-grade refrigerators. TrueCare didn't have adequate record-keeping of who was vaccinated, as was required by the CDC and other clinical guidance, and so it's been difficult to have even a full counting of who received these spoiled vaccines during the period between July and September of last year. And it wasn't just mishandled vaccines, but TrueCare didn't have required on-site medical equipment and was missing certifications for staff members, such as CPR and COVID precautions and similar training. Dr. Ray also found that TrueCare was grossly unfamiliar with CDC and state reporting policies. And even though Dr. Ray first brought her concerns up in September of last year, the department did not begin to try to find those who were vaccinated with these spoiled vaccines until December, when the press began asking questions. What Dr. Ray has conveyed, however, is that TrueCare is only the tip of the iceberg and that the fundamental problems inherent at the department are far worse and deeper. And I'll explain that in a second. The recovery program had personnel delineated, as you can see here, between those handling operations on one side and the other personnel who have clinical expertise on the other side. Ordinarily, you would have both these arms working hand in hand with the operational leads, organizing the clinics, handling logistics, and managing the arrangements to have clinics set up. And then you would have the clinical personnel handling the vaccines, training the vaccinators, ensuring that they were operating within proper compliance of CDC clinical guidance. Instead, what is occurring is that these operational leads are overruling oftentimes the clinical experts. And if the clinical advisors provided the wrong answer that was contrary to what the operational leads were looking for, or if the clinical field staff were too critical in identifying compliance shortcomings, the operations staff would move on to another clinician for their input, a practice akin to kind of doctor shopping or clinician shopping. As Dr. Ray can attest to, the operations leadership skipped key safety steps, such as requiring clinical staff or these vaccinators to have necessary training and certifications. They even had vaccination clinics administering vaccines to 5 to 11-year-olds by contractors who were not trained in administering pediatric doses. In other instances, there were clinics that were operated that fell short of CDC guidance and procedures, such as TrueCare's disregard for maintaining storage temperature for the vaccines. And to quote Dr. Ray, quote, "The goal of the recovery program is to continue operations, so guidance that appears to be against this or even threatens to slow things down is considered an obstacle rather than an opportunity for improvement. The whole program is run by contractors who know that if the mobile vax program ends, their job may end. The incentive to, quote, invent need is clear and very motivating, as well as very expensive and risky to the public." And those are the words of Dr. Ray herself before the Joint Committee on Fair Practices and State Personnel Oversight last week. As though these contracted mobile vax sites were not concerning enough, though, the organic mobile vax sites, the ones that were operated by the department themselves, and with MDH's own employees, were vaccinating Marylanders often with even more concerns than TrueCare itself. The shortcomings of MDH's own organic sites, their own in-house sites, and abiding by CDC guidance included using untrained staff, failing to have identified clinical lead on site at these clinics, clinical staff who had not undergone proper CDC training or certifications, sites that often lacked EpiPens in the case of a reaction, and the absence of even temperature tracking, and these were MDH's own clinics. The drive to vaccinate as many people as possible led to a, quote, qualifications be damned kind of mentality with personnel that were untrained in administering pediatric doses to unvaccinated kids, and inadequate personnel who had left some employees staffing clinics for 15 days in a row. These were state employees staffing clinics for 15 days in a row without a break. When Dr. Ray brought these concerns to her immediate supervisors, they ignored her, and when she was persistent, they retaliated by demoting her, moving her out of her office, taking her out of her clinical role, and moving her into a non-existent administrative position. Her colleagues were threatened that if they came to talk to her, that they would see consequences as well, with clear implications that others should keep quiet if they wanted to avoid the same trouble that Dr. Ray is experiencing now. To her credit, Dr. Ray's continued to bring these concerns to light through the proper channels. She initially reached out to the Office of Inspector General at the Maryland Department of Health, and after a long delay spanning many weeks, finally received word that the clinical compliance concerns were outside of the purview of the Office of Inspector General. She reached out to the MDH's Office of Audits and Compliance and received no help. Instead, she was referred to the Office of Equal Opportunity Programs, which is the department's EEOC office. Then she was referred to the statewide EEOC office of the Department of Budget Management. She was told by the statewide EEOC coordinator that it was the office's job to defend the department. In other words, to counter her claims, and that the EEOC coordinator even told her that she had never lost a case in defending a state agency. In other words, that Dr. Ray should expect to lose in her discrimination case. So as you can see, Dr. Ray was bounced from one office to another, simply trying to do the right thing, raising a very real concern for safety and clinical compliance, and then trying to find the right channels to file a retaliation complaint, which was bounced between OIG, Audits and Compliance, the EEOC office, and both MDH and also DBM. She finally turned to the feds and to the CDC, which has now triggered a Department of Health and Human Services investigation. But to add insult to injury, she's been told now that the HHS investigation, the federal investigation, will take 3 to 5 years to complete. And that's why she finally turned to the press, and she was brave enough to come forward publicly. This is not how the state should be treating whistleblowers with legitimate, well-founded concerns, particularly ones that endanger Marylanders' health. The goal of this bill is to protect the state's public health by adding more oversight of third-party contractors employed by MDH through emergency procurement contracts. The bill will create a new compliance officer position within the Office of the Inspector General, within the Maryland Department of Health, and establish professional qualifications for this position that include experience and education in the areas of administrative management, healthcare compliance standards, and public health. The compliance officer and the Inspector General will help monitor compliance of clinical programs run by MDH itself, similar to the Office of Healthcare Quality for nursing facilities, if you were to use that analogy, which includes third-party contractors working on behalf of the state and ensure that they will follow best practices in healthcare and public health, as well as laws, regulations, and departmental policies. The bill also clarifies that the IG has the authority to investigate public health issues in the Maryland Department of Health and entities contracted by the department, as the current language is murky and more focused on the investigation of financial or fiscal issues by the OIG. In addition, the bill directs the compliance officer, in addition to the Inspector General, to investigate behavior at MDH and contracted entities that threaten public safety, demonstrates negligence, incompetence, or malfeasance, and gives these offices the authority to carry out these investigations. Finally, the bill requires that there be an audit conducted by an independent auditor for each emergency procurement contract that occurs within 90 days of when the contract is awarded. The bill will help ensure better stewardship of taxpayer dollars by requiring the department to build into any emergency contract that goes before the Board of Public Works an independent audit that will be conducted within 90 days. We've also requested an amendment to address a concern that arose from Dr. Ray's experience. After notifying MDH's Office of Inspector General, she hadn't heard a response in weeks. And only weeks later came a response that her concerns were outside of the Inspector General's office's purview. This amendment would require OIG to respond within 7 days to any whistleblower as to whether the complaint fell within the purview of the Office of Inspector General or not. I think it's at least minimal due diligence for the Office of Inspector General to respond to these types of complaints in a timely fashion to tell the complainant whether it falls under their purview or not. And we'll distribute that amendment as soon as we have it back. So in closing, there were major issues that Dr. Ray has identified that have the potential to jeopardize the health of thousands of Marylanders. These have been well covered by The Sun and other media reports. It's my hope that by creating more oversight and transparency, we can prevent similar or even worse circumstances from happening again in the future. I would like to thank publicly Dr. Ray, who first brought many of these issues with our vaccine contractors to our attention, and for her willingness to testify in support of this bill. I believe our state and many Marylanders owe you a debt of gratitude. Committee, in your packet, there are news articles that have covered Dr. Ray's ordeal and concerns with the administration of the spoiled vaccines. She's also appeared before the Joint Committee on Fair Practice and State Personnel Oversight last week, and a full transcript of her verbal testimony with additional details and context are in your written testimony packet for this bill as well. With that, I'd like to thank the committee, urge a consideration of a favorable report, and happy to either answer questions or turn it over to Dr. Ray for her testimony.
Okay, so just so that I'm clear, the main things that you want to happen at this point, based on the bill, are a couple of things I think I've heard, and I want to be sure I didn't miss anything. Could you just tell us 1, 2, 3, the 2 or 3 things you'd like this bill to accomplish?
Sure. So we can boil it down to three things. So one is setting up a compliance officer within the Office of the Inspector General. That the Office of Inspector General has a tendency to conduct financial or fiscal audits, that they don't necessarily have the expertise to look at some of the clinical compliance and regulatory compliance issues. This would also broaden the purview a little bit of the Office Inspector General to also include clinical compliance considerations. Because most of what they're focused on right now is waste, fraud, and abuse. That doesn't encompass and include the clinical compliance pieces. Two is to have these emergency procurements also undergo an audit on a more timely basis so that these could be picked up more frequently. And then three, to make sure that, and I think that was in the amendment that we're looking at, that the Office of Inspector General would respond to a complainant within 7 days to at least let them know whether they could look into that issue or not.
Okay. Are there any other, Senator Augustine?
Thank you, Madam Chair. Sorry for this terrible experience. You know, I just must share, though, with sponsor, the IG typically, you know, obviously they want a level of independence, and the 7 days and requirements like that, in my experience of working with IGs, I mean, and I understand they're kind of probably silent on this, but that would be something that they would potentially feel hinder their independence. And so have we heard from the IG about these changes, and have they responded to that? And then the other part is around the compliance officer. I also I will take a look at it. Typically, the IG does have broad jurisdiction. I mean, that they do. I'm not saying what they may or may have chosen not to do in this instance, but they do have those. I mean, that's typically how it's set up. So could you just address that for me?
Sure. So, and Dr. Ray can speak to this in finer detail as well. So she did reach out to the Office of Inspector General. She finally did hear back from them, and their response was that this was outside their purview. But they took, you know, weeks, I think it was 94 days or something, for them to respond with just a response that it was outside their purview. You know, we're not asking them to do the entire investigation within 7 days. We're asking them to respond to a complainant to let them know that this is the right door or this is the wrong door, and you should go to that door to address your complaint. It's not too much, I think, in my view, to be able to respond to a complainant to let them know whether they're standing in front of the right door or not. And so that's what we're hoping to do with this.
I was asking, actually, I mean, I appreciate with regard to her specific case, I'm not trying to suggest what but more globally speaking, as the IG functions, because there are instances where it takes more time than, let's say, a given period when they're doing an investigation research, or they may not, you know, may choose not to communicate. I'm just saying from my experience in working with IGs and how their process works, that 7 days may not.
Well, I'm open to looking at longer durations. I don't think we're locked into that. I think, you know, her experience was 94 days with a negative response. I think there's probably a lot of room in between there that we can find a place that would be a little more responsive to these complainants so that they know that this is not even the right place to turn to, that you should turn to somewhere else for this concern. I don't think it's that much to ask for. We're not asking for an investigation. They don't need to do their whole investigation within this time frame. They just need to respond, just like you would say, can you acknowledge that you've received this and let me know if I'm knocking at the right door or not. If I'm not, then please redirect me to some other venue that's more proper.
Okay, thank you.
Let me just butt in and just say this. My sense is that since IGs very often are dealing with audits for fiscal matters, and if that's all we have to go to in this case, when you're really talking about if clinical practices are being mismanaged and if patients might be hurt, and we're in the middle of a pandemic, and could someone die or end up with COVID when they should not if the meds aren't properly stored and handled, and I think I've heard some of all of that. Then we don't know yet what altogether the answer is. The sponsor is suggesting a way we might want to go. That may or may not, I mean, maybe we need another entity, or we need certain IGs that can focus on performance. That is when there are managerial and health-oriented concerns, which could really impact their whole society, as opposed to, the typical financial audit. I just don't know. But let's hear now from is there any other question in any of you? All right, let's hear from your main witness.
Thank you, Madam Chair and members of the committee. I'm here to support the bill that's meant to strengthen the MDH-OIG adherence.
Now, you're going to need to pull that a little closer. You
Sure.
got a tiny little voice.
Thank you. I can project, but
Yes.
I can hear it now, okay. Thank you. So I'm here to support the proposed bill that's meant to strengthen the MDH-OIG adherence to their intended mission and roles by sharing my experience as a whistleblower of the MDH Recovery Program. The MDH Recovery Program was built to support the transitional recovery of Maryland into a new post-COVID normal and even gain best practices for our next community health challenge. But their business model prioritizes productivity over clinical caution and sustains a culture of clinical disregard to meet operational aims. This culture affected every aspect of the organization. Most critically, it resulted in unsafe and unreliable vaccine sites, monumental taxpayer costs, misuse of federal funds, abuse of staff rights, safety compliance violations, and now a normalcy of retaliation. My internal reports only resulted in worsening conditions for patients and staff and increased retaliation. So I escalated my concerns to the OIG as a proper authority to exercise their mission, which is to promote the integrity and accountability within MDH and to deter and investigate fraud, waste, abuse, and misconduct, including audits of programs that receive MDH funds and investigations of employee misconduct and abuse and noncompliance of federal regulations. Instead, MDH-OIG referred part of my complaint to another office and did not respond directly to me until 93 days later when the EEO office prompted them. The 1 month late reply was, "Your complaint does not fall under the purview of the OIG for Medicaid," and they advised me to contact the HHS instead. However, only one of the 6 listed action bullets that they have on their website mentioned Medicaid. And my complaint covered multiple other areas which were within their responsibility. They did not reply to my request for clarity of how my complaint did not fit within their purview or provide a report of how they made that assessment. In a couple of weeks, it'll be a half year since I submitted my initial complaint, yet public safety risks, staff abuse, and retaliation are continuous. The OIG advertised responsibilities for MDH integrity and accountability have yet to be addressed, especially in the areas of internal investigations and the identified MDH staff who are responsible. The bill discussed today is meant to help prevent reports such as mine from being unjustly dismissed, so we hope you will support our aim to build a stronger response team that will protect people willing to trust the integrity of our MDH systems. Thank you, and I'll take any questions you may have.
Are there any questions? Okay. And Senator Augustine, I'm wondering if you'd be willing maybe to pull a little work group together, because she was asking for 2 kinds of services from the IG. One is the more usual, and I can understand that's going to take a while and require a lot. The other was in the middle of a pandemic, if people are getting bad meds, which could cause life-threatening outcomes, and nobody's paying attention. So, okay, thank you. All right, and thanks for bringing the bill to our attention. Okay, all right, thank you. All right, we're going next to Senator Wallstreicher, state minimum wage rate, acceleration. This is a labor and employment issue. And let's see, let me call up your panel. Brig Dumais, Denise Gilmore, and Terry Kavanaugh. Those people are here. Come up. Okay. Is Laura Howell in the room? She's favorable with an amendment, so you'll go after these who are just favorable. Okay. Senator, you're on.
Thank you, Madam Chair.
Take the time you need.
I appreciate it. I think we may have lost some witnesses due to the late hour today, which is fine. So, Madam Chair, Mr. Vice Chair, members of the committee, we're seeing something now that we haven't seen during my lifetime. And for those of you who have seen it before, it was probably before you were in public office. It's inflation. and it's quickly eating away at the incomes of our constituents. Gas prices are higher, food prices are higher, medicine prices are higher, housing prices are higher. But there's one category that has not kept up with those higher prices: wages. For many of us, inflation is a nuisance. For some, it's an imposition. But for the most vulnerable among us, it is a disaster. As President Biden mentioned last week in his State of the Union, the best way to battle inflation is to raise the minimum wage. This bill doesn't do that exactly. It keeps our state's minimum wage at $15 per hour. But what it does do is accelerate the time to get there. The $15 minimum wage would go into effect on our usual effective date later in the year, with small businesses having an extra year after that to get to $15. This is an issue of economic justice. MIT estimates that a full-time single person needs $17.25 an hour to live, $34.74 for a single mom to raise one child. Two working parents with 3 kids, like my family, they need to make $56 per hour total. By these standards, an immediate increase to $15 is a deeply modest and reasonable proposition. Of course, this is also an issue of racial justice. People of color, as this committee well knows, are disproportionately represented among those who make the minimum wage. And so increasing the minimum wage immediately, by definition, benefits those communities who have been historically marginalized in our state. Who makes the minimum wage? Well, it's exactly who you think: the very people who have made the past 2 years bearable. Minimum wage workers stocked our grocery shelves while we were on lockdown. They cooked our food when takeout was the only option. They laundered bed sheets when our hospitals were filled with COVID patients. They are still doing those things, often without recognition or even complaint, and never for the pay necessary to support their families. Today, this year, we hold in our palms the power to change the lives of these hardworking Marylanders. We have the power, with a vote, to increase the pay of thousands of Marylanders. We have the power to bring true economic justice to our state. An immediate $15 minimum wage will allow our workers, businesses, and neighborhoods to build a stronger economy and thrive. I ask for a favorable report.
Thank you. Are there questions for the sponsor? All right, Senator Jennings.
So what's the minimum wage now?
So I believe we're at $12.75. I'd have to check the chart.
So we're gonna bump to, is it $15.50?
To $15.
$15, so it's gonna be $2.25.
In July.
Increase in July.
That's right.
So companies are gonna have to,
Can you talk into your mic?
oh, I'm sorry, it's a long day. So how quick are we pushing this up? When was it supposed to go up originally? What was the date?
By 2025.
So companies would normally have 2 years to be able to build this into their price structure and their business model, but now we're asking them to do it in 5 months, 4 months.
So most companies are already building this into their price structure. This isn't as big a leap as it would have been, say, last year. Because of competition for workers, wages have gone up for many of our low-wage workers, especially at the bottom of the income scale. And so this is really very few companies that haven't already made this leap. This bill takes those companies and brings them along with other companies like Starbucks and Pizza and others who have increased the minimum wage to $15 already.
No, I see it. I know how hard it is for companies to find people, that they have raised rates. I just think that and I understand the plight of the worker, but also I look at the side of the business.
Sure.
And how tough it is out there right now. You know, now you have fuel costs going up. If they're doing deliveries, the crippling effect of that, the fact they can't get product to put on the shelf. And I just think that this is going to be way too quick to push this thing up in 4 months, so.
Okay, are there other questions? All right.
Thank you.
Let's go to our witnesses. You have 2 minutes each.
Good evening. My name is Bridge Dumais. I'm with 1199 SEIU. We represent over 10,000 healthcare workers across Maryland and DC. We urge a favorable report on this legislation. Healthcare workers are experiencing a dual crisis right now. COVID-19 has an impact on public health, but they are also struggling with the consequences of short staffing. These crises are detrimental to both the patients and the workers. Typically, healthcare workers should not care for more than 14 patients per shift, yet our members are caring for 28 or more. Just this week at a long-term care facility in Baltimore, an entire unit quit on the same day, and they walked out and told management they all found jobs with better pay. Low wages are the leading cause of short staffing. When asked how short staffing impacts her patients, Holly Ward said, "When we are short staffed, treating patients becomes like working on an assembly line. We are not able to give the high quality care our patients deserve." When asked how short staffing impacts her and her coworkers personally, Reba McKinney said, "It is insulting that we dedicate our lives to care for our patients and we cannot afford to care for our own families." Throughout the pandemic, we've heard over and over again that healthcare workers are heroes, yet we are paying them like they are zeros. This bill is the only legislation before the General Assembly this year that will quickly and immediately raise wages for healthcare workers across the board. If we want to fix short staffing in healthcare, increasing the minimum wage to $15 an hour is absolutely crucial. 1199 members are saying loud and clear, short staffing is an emergency. We are burnt out. We need your help. Raise wages now. In the last few moments of my time, I would like to say I sympathize with small business owners. I am the child of small business owners, and if businesses don't have customers, they're not going to survive.
Okay, any questions? All right, we'll go on to the other witness.
Thank you, and good evening. My name is Denise Gilmore, and I'm a field director with AFSCME Council 3. We represent 30,000 state and higher education employees across Maryland. I want to just piggyback off of my union sibling on impacts on small businesses. You know, it doesn't all have to be bad. I mean, where we raise wages, we know that turnover decreases, the cost that you spend on training employees is minimized. There are benefits to having a stable workforce that can afford to pay its bills, that show up to work every day and are, happy to be there. And raising wages are a really big piece of that. We look at this obviously as a union that represents state employees, our sibling unions, Council 67, Council 2250. They represent county employees and local school employees. We also see this as just quite frankly smart economic policy. I mean, where we are lifting the wages of low earners, they don't spend that money, on fancy vacations somewhere in Italy, right? Like generally they're spending that money right back in our neighborhoods, in our pizza joints, at our barber shops. That's all local revenue that gets generated that certainly helps our members as they're funded by tax dollars, but also, ensures that we're lifting the standards for all wages in the state, which is ultimately what's going to help us with the incredible income disparities that we have in this state. So we urge a favorable report on Senate Bill 721 and certainly appreciate the sponsor for bringing it forward. Thank you.
Okay, Senator Jennings.
So this is for either of you, and again, I understand the plight, but we are right now in what I call a worker's environment. You can go find a job anywhere. People will hire you as quick as they can. Quick example, Monday nights, many of us go out for dinner. The 24-hour restaurants that we normally go to are closing at 10 o'clock because they can't find staff. They can't find people to work. And, I see it all the time, help wanted, trying to get people to work. And, your example of what's happened in the healthcare, I see it. But it's where the market, I think, needs to drive it. And I guess my one question is, the facility that you're talking about, because I have heard from the healthcare industry where, and that's dealt with the ratepayer system that we have, how they're reimbursed. You kind of have the crunch here of what they're having to pay the nurses and the doctors and all the other support staff versus what they're getting reimbursed. And, you know, is there anybody else that's going to testify other than the unions on this bill in favor of it?
Not,
Okay, I take it that that's a rhetorical question.
Yeah, I guess so. I mean,
I would also encourage you, we do have testimony from business owners who are in support of this legislation that was submitted in writing. They were not able to be here today because they're busy running their businesses, just as our members were not able to be here today because they are so short-staffed. And I think it's really, really important to know that not all workers are unionized workers. Therefore, they don't have the collective bargaining power that union workers do. And when you go in and you see these jobs that are paying over $15 an hour, those are not the jobs that are short-staffed. So yes, a worker could go get a job where they pay more, but those are limited positions, right? So we need to make sure that all businesses are paying a minimum wage of $15 an hour so that folks don't have to go through the instability of uprooting their entire lives to change their jobs. We really need to raise the wage floor. It's an emergency in Maryland. People cannot afford to live on under $17 an hour, as Senator Waldstreicher pointed out earlier. Thank you.
Okay. All right, I see Senator Hershey.
Thank you, Madam Chair. Just to follow up on that, you represent SEIU and ASME, right? Aren't your members under collective bargaining agreements?
Absolutely, and that's one of the strongest things that we have as unions is to fight to raise wages, but not all healthcare workers are unionized, and so it is still continuing to cause a short staffing crisis because we don't represent every single healthcare worker in the state.
No,
And when
but the ones that are in your union, weren't you able to negotiate over $15 an hour?
We are very successful at negotiating, and that is what we do as a union. That doesn't mean that all members currently earn $15 an hour. We are going to continue that fight at the bargaining table, but when we're able to pass legislation, then it gives us more time at the bargaining table to fight on other critically important issues. But again, this is not just about union workers, this is about all workers.
Well-
And we stand with all essential workers, not just our members.
Right, but I would agree with my colleague. We don't see anybody else representing private sector workers in favor of this legislation. So if this passes right away, do your members get an automatic raise?
They would have to be paid what the minimum wage in Maryland is, right?
Right.
Like, if their bargaining agreement is lower than minimum wage, then that doesn't count because you have to follow what the wage floor is set by the state.
Okay, but again, you did bargain above $15 an hour, right?
Many of our members make 15, many of our members make under 15.
And what
So
about
that is why
your-
we are here fighting for this legislation.
What about your members?
All of our contracts at this point are above 15. That was as of last July. The increases just happened. But, you know, they're working alongside contractors with the state. They're working along student workers that make below 15. You know, we're here in solidarity with
But
all
this
of
bill
the
doesn't
members.
affect you then,
So-
right?
Well, it affects our members in that the more tax base that we have in the state as people spend in these places, it certainly helps fund their programs,
Yeah,
fund their raises,
I meant
fund their
specifically on the
positions.
wages. Specifically on the wages, it won't affect you because you're over 15, and you just have some that are under 15 that you just were not able to negotiate over $15, right?
And not all of our members currently make
Right.
$15 an hour, and that's a huge problem.
That's
We
a
fight at
result-
the bargaining table and we fight at the legislative table because
Right.
we stand for all workers, not just union workers.
You stand for all your members, right?
We stand for all of our members and all essential workers. We believe in solidarity across the labor movement, whether someone is unionized or not, whether they work in a grocery store, a hospital, a restaurant, doesn't matter. We're all
Okay.
in this together as workers.
Okay, thank you very much. Thank you, Madam Chair.
Thank you very much. Now we're let's see, Laura Howell, apparently, was she? Yes, Laura. Okay, I thought I called you up. We'll hear from her, and then we'll go to the unfavorable.
Good afternoon, Madam Chair, members of the committee. It's nice to see you all in person. I'm Laura Howe with the Maryland Association of Community Services. We represent over 100 providers of services to people with developmental disabilities across Maryland. We are here today in support with amendment for Senate Bill 721, as we were in 2014 and 2019, and we're grateful for the support of this committee over those years. My testimony is short. I think you all know that developmental disability providers are predominantly nonprofits, and we rely on funding from the state and federal government. and we are prohibited by federal law from passing on any cost increases to the people we support. The most important thing I'm going to say is that our workforce crisis is the worst it has been in our history, with almost 1 in 10 community providers reporting in January that their vacancy rate was between 50 and 60% for direct support staff. The funding in the 2014 and 2019 minimum wage bills, while putting funding in for us, did not keep pace with inflation. And the people we support are now suffering the consequences with high staff turnover and difficulty in finding providers to offer services. And I know you all have people in your districts that will need services and will really struggle to find them. So we respectfully request an amendment that would mandate a rate increase that would truly keep pace with any acceleration in the minimum wage under this bill. Thank you.
Okay. Are there any questions? Okay, so your amendment is the rate increase would keep up with the acceleration and the, okay. All right.
Thank you.
Thank you very much. All right, now we have unfavorables. Let's call up the first panel. Mike O'Halloran, Andrew Griffin, Dana Kaufman, and Sarah Price.
Good evening, Madam Chair, Mr. Vice Chair, members of the Senate Finance Committee. For the record, Mike O'Halloran here representing NFIB in Maryland and the Mid-Atlantic Petroleum Distributors Association. Look, we heard from the proponents issues surrounding inflation. I can tell you here today that inflation is not stopping with workers or customers. It's impacting small businesses as well. In fact, just today, the Bureau of Labor Statistics reported U.S. inflation rose 7.9% in February. NFIB's monthly survey showed more than 1 in 4 small business owners rate inflation as their single most important problem. That's the highest since 1981. And this is in addition to the crushing impacts of supply chain issues that we've all heard about day in and day out on the news. So let's talk about Senate Bill 721. It speeds up the state's minimum wage increase to $15 by 2.5 years for employees with 15 workers, 3 years for those with fewer than 15 employees. So to put that in context, a small diner, let's say, with 15 employees, open 7 days a week, like many of you enjoy here in Annapolis during session, they will see an increase to their labor costs of upwards of $50,000 from July 1 to December 31st of this year alone. That's presupposing all employees are paid at the minimum wage, which we know they're not, more than likely. And that leads to the concept of wage compression, which is very, very real. You heard that during the debate on the minimum wage increase. And let me just say, since I brought this up, you know, the bifurcation in particular for our smallest employers, that was a hard-fought concession by this committee. You guys understood the position that small business owners are in. And like the proponents had said, and as Senator Jennings alluded to, small businesses are doing everything they can right now to compete for labor. It's not just minimum wage, it's $20, $25 an hour. So this begs the question that for our smallest employers who are just trying to keep their doors open, this is a bad bill for them. So we respect an unfavorable report. Thank you.
Thank you. All right, who's going next? Just state your name, and mics are movable.
Good evening, Madam Chair, members of the committee. For the record, my name is Andrew Griffin, here on behalf of the Maryland Chamber of Commerce. You have my written comments, so I will be quick. Raising the minimum wage from $12.50, which went into effect this year, January 1, to $15 on July 1, would be a 20% mandated increase in labor costs for businesses. That just further adds to the uncertainty businesses are currently feeling, the absolute opposite of what they need right now. There has been mention of wage increases and inflation, which Mike alluded to. In my written remarks, I have included the Bureau of Labor Statistics report as part of it, but I will read some of the wage increases that are cited in there. In leisure and hospitality, the wage increases have gone up 16% to $16.97 an hour, 7% in retail to $19.20 an hour, 8.4% in transportation and warehousing to $25.04 an hour. So all those outpacing inflation and well above the $15 minimum wage. And finally, the last point I will make, the bill also does walk back the authority of the Board of Public Works, that the off-ramp in times of heightened unemployment. I would argue that that hardly seems unnecessary at this point. If there was ever a time it would have been used, it would have been in 2020 and 2021, which it was not. So with that, I will conclude, urge an unfavorable report. Happy to answer any questions.
Are there any questions? Okay.
Madam Chair, Vice Chair, and members of the Finance Committee. My name's Kurt McCauley, and I represent service stations and convenience stores in Maryland. First, I want to apologize. My written that I sent in had a figure on the 14 and under was off by about $30. It's actually $88 per employee per week in 2023 when that starts. On the 15 and over, it starts in 2022. It's about $100 a week per employee with that raise right off the bat, right in July 1st, 2022, about $100 a week per employee. And you got to figure taxes, benefits in there, and FICA and all that. So I'm basically going to say me too because they've already said it. It's all done. The comptroller's office said there was 40,000 small businesses gone in Maryland. Let's not make it 30 or 45 or 50 because this bill could be very hurtful to the small business, especially our 24/7 convenience stores and stuff. And we're talking about a lot of money, and they've been through a lot. All our workers were essential. They worked straight on through when we didn't have any business because there wasn't any street, and truthfully, the business is not back up to normal. So we urge an unfavorable report.
Are there any? Senator Jennings.
Kirk, you just mentioned 24/7 convenience stores. There's a Royal Farm up near me. The other night, I had to run out late at night to get diesel fuel, and they were closed. And it says close at 10, open at 6. Is that because they can't find help?
That's unusual for a rural farm. They're not one of our members.
Okay. But are these convenience stores are they having a hard time hiring employees?
Well, they are having a hard time hiring employees. We've had stores actually had to close up at night also because of that. Or the owner go in and work himself all night long and come back in and work as long as he can during the day and split his employees up and everything. Okay. So
thanks.
You can't hire,
All right, and
good evening, Madam Chair and honorable members of the committee. My name is Sarah Price, here on behalf of the Maryland Retailers Association. Our membership does include a variety of shapes and sizes of businesses. We have, national level chains, but we do also represent thousands of small mom and pop businesses in the state. So when the legislature passed the increase to the minimum wage, we worked with you in good faith to negotiate for a reasonable phase-in period, particularly for those small businesses. As has just been discussed, many businesses are currently stuck in a vicious cycle where when they were able to reopen after the initial pandemic shutdowns, they were suffering from low revenue, so they reopened at limited hours, and now as a result, they are not able to generate the revenue that would be required to bring in additional staff to reopen at their regular hours. Many businesses are still reporting that their revenue rates have not returned to pre-pandemic levels at this time. Other than that, ultimately, I would say me too to the rest of the panel. We believe that this would be detrimental to businesses, and we would urge an unfavorable report. Thank you.
thank you. Are there any questions? All right, what about Melvin Thompson? Okay.
Thank you very much, Madam Chair, members of the committee. Melvin Thompson, representing the Restaurant Association of Maryland. We also strongly oppose this legislation, and I would simply echo the comments by my business group colleagues. We urge an unfavorable report. Thank you.
Okay. All right. Okay, that ends the testimony on that bill. Okay. All right, we're going now to Senator Carter. Username and password privacy, law enforcement agency exemption. Let me call up your panel. Michelle Wurtzberger? Okay. What about Adam Abeder?
He is
All
present.
right. And Jim Gillis?
Present.
All right. Okay. Okay, let's do that. You have all the time you need to lay out the parameters of your bill, and you guys will get 2 minutes each.
Thank you, Madam Chair. Thank you, members of the committee. I know this is the last bill of the day, so hopefully it won't be too much of a heavy lift for you. I think it's pretty simple, simple bill for you to consider. We'll lay out the reasons that we need the bill. Basically, you all are well aware that Baltimore City Police Department is under consent decree. And the consent decree calls for the department to have access to the officers' social media accounts. But Maryland law prohibits employers from having access to those accounts. And so this bill simply would carve out an exception for these law enforcement agencies. The bill is enabling, so certainly an agency that did not want to do this would not be forced to under the bill, but basically it would be enabling. And so with that, let me just elaborate more into my testimony. Senate Bill 851 has been requested by the Baltimore City Administration. It would authorize that certain law enforcement agencies request the username and password of employees or applicants for the purpose of reviewing their social media accounts. To achieve this, the bill exempts such agencies from the prohibition in state law against employers requiring employees or applicants to disclose their username or password or other means for employers to access a personal account or service through the electronic communications device. This bill is important because it would help ensure that communities in Maryland are policed by persons with integrity that those persons that are granted the authority to enforce law are mentally and emotionally fit to serve the public. This bill attempts to ensure that individuals seeking employment in law enforcement fall within these categories, a criteria of which includes not having a social media presence that promotes racist, antisocial, abusive behavior, or associations that are otherwise inappropriate or criminal. This bill is particularly important and necessary for Baltimore City. The consent decree, of which Baltimore City Police Department and city are bound to adhere to, mandates that Baltimore Police Department, as part of its background investigations, evaluate the social media accounts of candidates. In addition, this bill also aligns with the goals of last year's historic police reforms, which sought to impose better accountability measures and standards for policing in Maryland. And for these reasons, I would urge a favorable report. Thank you.
Before we go to the other, I want to be clear. So you're saying you've got police officers using derogatory or racist passwords and usernames?
Well, no, so this would, what the bill would allow the agency to access those accounts, basically to, if necessary, they'd be able to ascertain that. So it would just allow them to have access to these officers' accounts. The law, our current law says employers don't have a right to violate the privacy of their employees' social media accounts if those accounts are private. But this would carve out an exception for law enforcement.
Okay.
And again, just enabling.
Do you know of any other level of government in Maryland or elsewhere where they already have what you want to have happen?
I do not know, but perhaps one of the witnesses, again, this was brought by the city administration, and BPD is simply seeking to comply with the mandates of the consent decree. So I think that's the impetus for the bill.
Okay, we've got a couple of questions for you, and then we'll go to your witnesses. Senator Jennings and Senator Bidle.
So my question is, does the consent decree actually say password and username? Or does it just say, monitor and research their account? Because, anybody can go onto your Facebook account and look at everything you've posted over time.
So I
Well,
believe,
unless you're not a friend.
I believe it calls for the ability to access and evaluate the accounts, but I'll let the experts from BPD talk about it.
To me, I just question, I'm not a constitutional scholar, I'm not an attorney, but.
I agree, it sounds,
To me, it sounds like a violation of First Amendment that you're going to break into my account and go through
well,
it.
not break in.
Well, let's be honest.
Under this bill, the ostensibly, the candidate or employee would be asked.
I have to now, give that to you versus saying, hey, just give me access as a friend so that we can go and look at it.
Yes.
Okay.
Okay, Senator Bidle, and then we're going to the witnesses.
Thank you, and I'll wait for an answer on the password, because I think Mr. Gillis is ready to answer that. But I understand that Baltimore City has the consent decree. Why don't we do this just for Baltimore City? Because all of our other departments don't have a consent decree, and I see there's opposition.
So that wouldn't be a problem for me. I'll let, again, the city administration speak about that, but that wouldn't be a problem for me. I think that I can't speak for them, but I think that because it's only enabling, certainly no other agency would be required to do it if they didn't want to. So,
Okay.
I mean, if you wanted, I would suggest that since this bill is to ensure compliance with the current consent decree, if this committee wanted to place some type of an amendment on it or even some type of a sunset, I would think that would be reasonable, but I can't speak for the city.
Okay, Senator Hayes, and then we're going to the witnesses.
Thank you, Madam Chair. And I get what my colleague, Senator Bidle, is saying. Like, if this is a Baltimore City issue, why don't we just deal with Baltimore City? But I guess I would ask the question a different way. If oftentimes when you have Facebook pages and other social media, you join various groups of interest. And as a law enforcement officer, not just in Baltimore City, in the state of Maryland, wouldn't we want to know if that law enforcement had membership in organizations like the Ku Klux Klan or the Aryan Nation or some other rogue terrorist group or something like that? Wouldn't any law enforcement agency in the state want to know that type of stuff?
I can't speak for what any law enforcement agency would want to know, but I think that is exactly part of the reason why this is in the consent decree, because we had officers that were, having questionable affiliations and other things. Is that correct?
All right, okay. Well, let's go to our, let's see, is Adam Abadir? Okay, all right, let's go to you.
Great questions. First, good evening, Chair Kelly, Vice Chairman Feldman, members of the committee. For the record, my name is Adam Abadir with the Mayor's Office of Government Relations, speaking on behalf of the Baltimore City Administration. Please be advised, the Baltimore City Administration supports Senate Bill 851, and we'd like to thank Senator Carter for introducing the bill on behalf of the city. Senate Bill 851 would exempt certain law enforcement agencies from the current prohibition against employers requiring employees or applicants to disclose any username, password, or other means for accessing a personal account or service through an electronic communication device. I would like to reiterate that this is enabling language. A law enforcement agency does not have to request information from personal accounts from either employees or applicants should this go through. They can simply elect not to request the information. This bill ensures that those who need to can. Enabling this option is important. Broadly speaking, social media should be considered a window into an individual's true thoughts on a diversity of subjects protected, of course, by free speech and First Amendment rights. However, the powers granted to law enforcement, including the power to detain and even in certain circumstances use deadly force, must be weighed against an officer or potential officer's implicit and explicit biases, of which sometimes are expressed on social media. By reviewing the social media accounts of all applicants, police departments across the state would be in a better position to determine if their hires, sworn and civilian, maintain a positive social media persona that does not promote or betray biases or other form of behavior not suited for constitutional policing, including racism, domestic violence, inappropriate relationships with known criminals, or other antisocial behaviors. Mr. Gillis from the Baltimore Police Department is here to talk about how Senate Bill 851 would affect BPD's hiring process, as well as touch upon the federal consent decree in place that this law is designed to satisfy. For these reasons, we respectfully request a favorable report on Senate Bill 851.
Okay, let's hear Mr. Gillis, and then if there are questions, we can go back to.
Thank you, Madam Chair. Madam Chair, members of the committee, Jim Gillis. I'm one of the Deputy Police Commissioners of the Baltimore Police Department. And I will be very brief. I know it's late. Thank you for your time and sticking around, obviously. There is nobody in this building, and I can promise you that, who wants to hire more cops than I do. It is my job at the police department. And so all I do all day is try to spend my time figuring out ways to hire more cops. This bill is meant to help us hire the highest quality police officers we have. And so I am telling you, as the person who's charged with hiring police officers, that this is good legislation. And it is something, to answer your question, kind of about do other jurisdictions do this around the country at other levels. This was not a prohibition 2 years ago or any years prior to that. So without knowing the answer to the question, I suspect that it's not prohibited like it is here now. It may be catching traction elsewhere, but most likely not. It is common sense. We want to know who we're hiring. We want to be able to test their veracity when we hire them in the application process. I would imagine the military department probably does the same thing, actually. And as noted already, this is consistent with the consent decree, which is a mandate that we already have upon us. For those reasons, for the reasons stated in the written testimony, I will submit on those spoken remarks.
So if the bill were amended just to deal with Baltimore City and not to be a statewide bill, then it's meeting your needs?
For the police department, that would certainly serve our needs, definitely. I would caution against that because, as Senator Hayes pointed out, applicants apply to multiple police agencies around the country, quite frankly. And usually in the hiring process, whoever gets them fastest is how they pick where they go. And so they are going to be applying to other jurisdictions in the state of Maryland. I would imagine that any executive in any police department would want to have the discretion to be able to see exactly who they are hiring and then what their employees are doing when they are actually already hired as well.
Okay, we've got 3 sets of questions. Senator Hayes, Senator Feldman, Senator Battle.
Jim, I didn't get a chance to talk to you as much before this bill, but I did get a chance to talk to Michelle, but I understand she had child issues. But when she first explained the bill to me, I had some of the same concerns, I think, Senator Jennings. I'm like, give away my password and my username, you crazy? Like, you know, but the way she explained to me the process that she went through as an employee, and I don't know if you went through the similar process, I guess for the sake of the committee, can you explain, if you went through that process, what did it look like in practice?
Absolutely. Everybody does have to go through the process. That was a great question. That was a great question you echoed as well. And the reason that it is a little alarming sounding, the reason why we ask for a username and password is so that we can verify that it is in fact your account and not somebody else's. And that is very important, obviously, if we are testing the veracity of the content of whatever we're seeing. And to answer your question about what is the process, you come in for multiple steps. You sit down with background investigators. You are polygraphed throughout the thing. You have psychological testing. There are a lot of screening mechanisms that occur in hiring a police officer in the state of Maryland and in the Baltimore Police Department that are mandated and prescribed by law, but also by policy. This is just another screening mechanism. It is something we did before. It is helpful to continue doing it again. Again, it is common sense. And, you know, when you do come in, you actually sit down with the investigator and you log on with the investigator to your accounts. And they are able to ask questions about things to test the veracity of the person, so.
Right, just to expand on that, Madam Chair, and for Senator Jennings, the way Michelle explained it to me, when she came in, she sat with the investigator, they asked her to log into her account, and they said, all right, scroll up the page, okay, scroll up the page, okay. And they took a couple of pictures just to document that they actually went in there, and that was.
It is not as invasive as it sounds, is what I think you're getting at, and I would agree with that.
Correct. Thank you, Madam Chair.
I'm going to add to the list of other members who want to speak. So we have Feldman, Battle, and Jennings.
Yeah, just two quick ones. So I did talk to Michelle this morning. She, you know, I did a Zoom call with her. I'm still tying the connecting, because this started with the idea of consent decree, and I'm still trying to connect those two dots, like connect it maybe one more time, the connection between the consent decree specific to Baltimore City.
Sure.
And this, and then secondly, I was just reading some, before we would want to convert it into like a local Baltimore City specific, we probably want to talk to the AG's office. I think there may be some problem with us trying to apply this specifically only to Baltimore City. But that might be an AG Frosch kind of question. I'm just saying that there might be a temptation to say if this is about consent decree, before we jump there, we probably want to get a little guidance from the AG. But could you just, one more time, the connection?
Absolutely. Great question, Vice Chair. So the connection to the consent decree is a federal, there's a court case, and the Baltimore Police Department and the City of Baltimore are the defendants in the court case. The Department of Justice is the plaintiff. They are suing the agency and the city, essentially, to enforce reforms in the police department. And that is overseen by the chief judge of the District of Maryland, who is the We meet with them monthly, speak with them more often than that. All the parties get together. There is a 436-page or paragraph document, which is the consent decree. Contained in the consent decree are all of these prescribed mandates that the agency must accomplish in order to get out of the consent decree ultimately, to fulfill compliance is what it's called. One of them included in this is this. It's asking that we have screening mechanisms to ensure that we have the highest quality employees who we hire. The reason we are in a consent decree in the first place are because of obvious problems that have existed in the past with lack of supervision, lack of processes, hiring not quality people that have led to problems when they interact with the community or in the agency themselves. And so it is just a measure that is meant to help produce a better quality agency and a better quality workforce, which provides a service for the city that we serve, and hence a better city ultimately. The connection here with this legislation and the consent decree is this is basically asking you all to make it consistent with the language in the consent decree, or the mandate in the consent decree is a better way to say it.
Okay, thank you, Madam Chair.
Okay, Senator Bottle and Senator Jennings.
Thank you. So what does the consent decree actually say about this?
I don't have the quote in front of me.
You'll get it for us,
I
though.
certainly will, absolutely, yes.
And so, I talked to Michelle this morning too, and she talked about how, you'd sit down in the interview and look at the Facebook page. But this is more than that. You're asking for a username and password. Are you going to continue to check the Facebook page?
That is something that I'll give an example. There was a case a few years ago of a person who went out on what's called medical. Medical is a terminology that is utilized when someone is injured, either on the job or off the job. They're put into what's called a light duty status, or a status where they essentially don't have to be on the street working full duty. They have their police power suspended due to whatever happened medically. And while that person was not working alongside of all of the other employees in the crime fight, because they were out on medical, it was revealed that the person was off, I forget if it was a ski trip or skydiving or something, and that was realized because of a social media post. That led to an investigation, obviously, that led to consequences for the person. But the point of bringing that up is the only way to have found that in the first place was somebody, I don't think it was the agency, but someone saw it on social media. And so having all of the options available for us to make sure that people are maintaining integrity for which we hire them in the first place, I think is a smart thing to have.
My daughter's a workman's comp attorney, so I got that. But checking someone who's out on sick leave is different than what we're talking about in the consent decree. I mean, I'm just trying to protect people's rights, and I understand that you need to hire good officers with integrity, and that's what you do in the interview process. But do you continue to do that? And do they have to tell you every time their password changes? Because, sometimes you get a message that says, you change your password.
I'm not aware of a mandate like that exists, but that part of my portfolio is about the hiring and onboarding and growing the workforce.
And I understand
Yeah,
that, but
yeah.
I would like the verbiage in the consent decree.
Absolutely.
And I'd like the Attorney General's opinion.
Okay.
Thank you.
Senator Jennings, could I ask him one quick thing before you do? Okay, go ahead.
So, I was going after Senator Hayes, but Senator Bottle just picked it up on the password change. So let's say you're interviewing me, I'm coming in, sitting down with the investigators, and they say, hey, let's see your Facebook page, log in, password, and they do exactly what Senator Hayes said. I scroll through, all right, check this, check that, let's see what groups you belong to. When I'm done, am I allowed to then change my password, since, you guys saw me put it in? Well, I know you.
Yeah,
But my question is, I'm having to give it up, so if I change it, am I going to be in violation of this bill?
Yeah, I'm not aware of any requirement to notify us or to have to, keep it the same or anything like that. Truly, it is, I caution, and I'm trying to think of a way to explain it better to you all, to give you some comfort, that it is not as invasive as it is sounding. It is very simple, as what Senator Hayes was pointing out.
Okay, let me just ask one thing. I remember reading, maybe starting 2 or 3 years back, of maybe 9 officers who were found guilty of having misused their police powers and being actually corrupt, and some of them are now in prison?
The Gun Trace Task Force.
Okay.
Yep.
So is that the kind of situation that has led the city to feel it needs to move in this direction?
That is, I would say, part of the genesis for the consent decree in the first place. So yes, I would say that. But I would say to you, Madam Chair, that we are not moving in a new direction. We are going back to what we had the ability to do just a year ago.
Before.
And so it is nothing new in that sense. This is something we've always been able to do.
Okay. And while a lot of people here are in some consternation about the extent to which we should be supporting police, which we need to, and vetting police, I think when you have the kind of problem that obviously has come to light, and the city has had that experience, and some of those persons are still incarcerated because of their past behavior, I can understand more why you're asking. Senator Hayes. Yeah, I called on you, Senator.
No, it hadn't highlighted yet, so I was waiting for it.
But-
Thank you,
but
Tammy.
While you're waiting, I would just say we probably for now would be better off trying to get the bill passed as a bill for Baltimore City delegation or for the city of Baltimore.
Yeah, I hear you. I
Trying
think that's
At
a,
this late date to try to deal with it as a statewide.
right, I think that's a dangerous slippery slope. And that goes to the question that I had for Jim, Madam Chair. The consent decree, although Baltimore City is engaged in this consent decree, as you explained, is the Department of Justice that's applying these standards, but these standards are based on practice throughout the nation in law enforcement agencies. It's not just that Baltimore City right now is the subject of this, but the DOJ look across the entire country and are applying best practices for law enforcement agencies throughout the country, correct?
If they are able to mandate it in such a mechanism.
Right.
Yeah.
Gotcha. Thank you, Madam Chair.
Well, the vice chair just revealed that he's a former DOJ lawyer. You have any question that would help us to shed more light?
That's what I did before I did this.
But what about the idea, because the bill is here before us for the whole state?
Well, I have to think about it. I would like to, I'd like to talk to, obviously, Senator Hayes and see the actual language like Senator Bottle, I'd be a little,
Absolutely.
I really would be interested to see
Okay.
that.
And would you guys be available to work with a small work group?
Anything that you all need, we will make ourselves available.
Okay, so if those who are interested in participating in a work group or just maybe a single meeting or so, raise your hand. Would you? All right, so we've got Bottle, Jennings, Carter, Hayes, and Feldman. And I'm gonna ask you to pull it together. So we'll ask the vice chair to get the group together.
We have one more witness. Madam Chair, we might want to include the representative from the FOP who's prepared to testify against the bill.
Okay, let's call on him next.
Chaz, number 5.
Okay. All right, Chaz Ball from the Maryland State
Thank you,
Fraternal
Madam Chair. Thank
Order.
you, committee.
Thank you all very much. You too.
And Mr. Ball is from the Maryland State Fraternal Order of Police, and he's in the unfavorable.
Yes, good afternoon, or good evening, Madam Chair, members of the committee. My name is Chaz Ball, and I'm on behalf of the Maryland State Fraternal Order of Police. What I'll say is this: Maryland, the law that's in place now states that no public employee, no employee of the state of Maryland can have their employer ask for their password and their username to be able to get into that information. No other employee, and no other legislator, no judge, no executive or someone that's running for an executive position, no one with that power. But officers are going to be asked, not only in hiring, because by creating this exemption, it not only says that an employer can do that in the hiring process, but also can do that at any point when an officer works for them. They can say, I need your username and your password. And our usernames and our passwords, it's not the public profile, it's not everything that's on the Facebook page, it's not everything that's on the Twitter page. It's communications that we might have. It's the groups we might be part of. It's the First Amendment issues that we have. So it's every conversation that we might have with our coworkers, our family, our friends. It's our political beliefs, things we might not go and say publicly, but we believe. And that might be in someone's profile. Every police department in the city of, in the state of Maryland is undermanned right now, including the Baltimore Police Department by more than 500 officers. And now, by this bill, we're saying not only do we want you to raise your hand in a point of officer scrutiny, not only do we want you to raise your hand and come in to this very dangerous job, not only do we want you to raise your hand and come on to something where you might not go to your family at the end of the night, we want you to raise your hand and give up your privacy, your First Amendment rights, all the conversations you've had with your family, your friends, or anyone else. And I give you this last thing. Consider a deputy sheriff that might be thinking about running. That sheriff can ask him for his username and password and would know any conversation he had about that issue.
Okay. Do you want to participate if there's a work group?
Yes, ma'am, sure.
Okay. So why don't we leave it at that? We've got the information, and if your phone number or whatever is the best way of contacting you could be left with Senator Feldman, he's going to get the work group. All right. All right. Thank you so much. And that ends our bill hearing for today.